Good evening, ladies and gentlemen. It is 5:30, and I will call this special meeting of the Burnsville City Council to order. It is our tradition to stand for a moment of silence, followed by the Pledge of Allegiance, and we invite you to join us. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Information for everyone. This meeting is held both in person and virtually. Members of the public may attend in person as you are here this evening, or they may join us virtually. They can watch us on burnsvillemn.gov/meetings or Comcast Channel 16 or 859. The public can also participate through Zoom by joining us at zoom.us/join or by calling 651-372-8299. More information is available on our meeting webpage and in the council agenda package. There is only one item on today's special meeting. And the first item is to recall and reconsider resolution approving the national settlement for prescription opioid litigation and state subdivision agreement. And only the prevailing side can recall. So at this time, may I have a motion to recall this item?
Madam Mayor, I would like to recall and reconsider a resolution to approve the national settlement for prescription opioid litigation and the state subdivision agreement.
Okay. There's a motion. May I have a second?
I'll second.
Councilmember Gustafson seconds the motion. And the clerk can now take the roll because we have Councilmember Workman has COVID, and so he is joining us on Zoom, and so we need to do a roll call on the votes. And so, Councilmember Workman, I hope you're feeling better. Okay, clerk, take the vote, please.
Gustafson.
Aye.
Couts.
Aye.
Keeley.
Aye.
Schultz.
No.
Workman.
Aye.
And that is approved. And now we have our police chief and our fire chief who will be presenting this evening. Police Chief Tanya Schwartz and Fire Chief B.J. Jungman are presenting. Chiefs, are you going to present from the?
Right here.
You're going to present from right here?
Yes.
Thank you. Who's going first?
I am.
Okay.
Okay, can you hear me okay?
Yep.
Okay, good. Well, thank you, Madam Mayor, members of the council. As you mentioned, at a previous session, we were directed by council to come back with some information additional on the opioid crisis and then specifically some Burnsville public safety experiences with opioids and what we're seeing across the community. So I'm going to share a little bit of reported information with all of you, some visuals on opioid impacts across the country in Minnesota, Dakota County, and specifically in Burnsville. And then Fire Chief Jungman will also give some specific information that's related to the Burnsville community in terms of trends he's seeing from the EMS response and Narcan use. And also just want to say thank you to the Drug Task Force, our Drug Task Force commander, and our agents who helped supply some of this information that's being shared tonight. So I would draw your attention to this first slide. This is an overall picture of the opioid epidemic with some information across how this is impacting across the country and really specifically to misuse and addiction of opioids and becoming a public health crisis. And so as you look at these statistics, we can see that these are devastating consequences. They have serious impacts to people and to families and to communities. And Burnsville is not immune from these sort of impacts. And so drugs are being misused in our communities. And so we'll share a little bit more of information about that with you. And again, just to mention so everyone knows, our Dakota County Drug Task Force, that's a cooperative effort between all of our Dakota County law enforcement agencies and Savage Police Department. And they do a variety of things, but one of the things they do is investigate narcotics and removing illegal drugs from our streets and from our communities, drugs and weapons, and then responding to different types of calls where overdoses do occur. So that's just a little bit of background so everyone is familiar with the Dakota County Drug Task Force. When we talk about opioids, we really talk about those drugs are producing a morphine-like effect on the body. And so medically, they're primarily being used for pain relief, including anesthesia, but some of the more extremely potent opioids, such as carfentanil, are really only supposed to be used for and approved for veterinarian use. But we do see these drugs being used across our communities here in Burnsville and Dakota County, being mixed with other types of drugs. This is just a graph of all of the commonly abused prescription medications that our Drug Task Force agents are seeing when they are out in our communities, and then also the police officers and our EMS crews are seeing when they are responding to different calls for service. And again, just kind of the trends, when we look at it across the country, Minnesota and Dakota County overdoses are on the rise. And many of them are being attributed to lethal amounts of fentanyl or carfentanil that are being added into these drugs. So sometimes, people don't know what they're taking. They don't know how much they're taking. They have pain and they need help, but they don't know that what they're taking has other kinds of drugs in it. So people are overdosing. So we're seeing that trend. And then just in terms of prescription drug use, it's used more often than all of these other types of drugs combined. So when you look at cocaine and heroin and methamphetamine, prescription drugs are being used much more often even than those types of drugs. This is just a graph to show you a little bit from Minnesota hospitals on non-fatal overdose trends that they're seeing through emergency rooms, and they're seeing that opioid-involved overdoses are increasing for all different drug categories there from 2019 to 2020. A small increase in heroin, but you see that the increases are happening. And this is just another graph related to opioid overdose deaths in Minnesota. So as they continue to increase since about the year 2000. So just give you an idea. And that information is coming from death certificates. So sometimes it can be difficult to know where drugs are coming from if different types of drugs are in someone's body at the time, but these are ones that have been associated with opioids. And then this is a pin map picture of Dakota County overdose deaths that we're seeing in 2020 and 2021. And this is our OD map, so overdose detection mapping. And this is a system where police officers, responders can put information into the system live as they're responding to overdoses or suspected overdoses that they think are related. And then in live time, agencies across different counties can see this information and determine, is there a spike in increases of overdoses happening in a specific area? So maybe they can respond in a different way or look at education to try to get information out that we're seeing this increase in spikes. So they also can monitor non-fatal overdoses, but this, I just wanted to give you a visual so you could see some of the dots on this map and some of the things they track. So if you're looking at this map, the red dots there, those are fatal overdoses in the county, and those instances are when Narcan was not able to be administered for one reason or another. And then if you see the yellow dots there, those are for fatals with a single dose of Narcan, and then green is multiple doses of Narcan. So they can do that and map that for non-fatal and fatal instances of overdoses across the county. And not just our county, across the state and across many states. So it's just another tool for us to use. This information is as good as the information that's put into the system. So sometimes, it's not every single overdose is put into the system. And so Chief Jungman is going to talk a little bit more about really some of those specific responses that we do have in the city of Burnsville where Narcan is being used. So he'll share that with you. These are just two more graphs, just specific to Dakota County, as we see overdose deaths are increasing among Dakota County residents. So that first graph on the left, if you're looking at it, since 2000, you can see that deaths are occurring in Dakota County and are increasing. And then in 2020, just showing that opioids were the drug that was involved in the greatest number of overdoses among Dakota County residents. So another graph just to show opioid misuse among youth. And this information was taken from a Minnesota student survey of students in Dakota County schools. And so students were reporting and being asked questions about their prescription drug use over the last, past 12 months. And what they reported was that they were using prescription pain medications without a prescription, or they were using them in a way that was not being prescribed to them. So they're using it incorrectly. And so they're seeing a rise in that amongst our youth in 8th and 9th grade. And then you see there was a decrease there in reporting on the 11th grade. So just some information on youth use of opioids in our Dakota County schools. And then just trends in general, we're seeing a lot of drugs around our communities. So we're seeing methamphetamine, continuing to have a lot of drug seizures of methamphetamine. Those are growing each year, and we're seeing that those are being mixed with fentanyl as well. So fentanyl, heroin, all those overdoses are up. All of those deaths continue to rise across Dakota County. Cocaine seizures continue to be on the rise, and marijuana continues to be the most widely available type of illicit drug that is being used. So all of these drugs are moving around our communities, across our state, and here in Burnsville as well. And then just a little bit specifically more about Burnsville, we're seeing oxycodone, heroin, and fentanyl, so we're seeing a lot of pills. And the biggest thing that we're seeing with pills here is that the main cause of those overdoses with pills is that those pills have fentanyl in them. So these pills are being mixed. People don't know what they're taking, and they're taking too much. So, or they think, their body can accept what they think they can take, and then the body can't do it. So that seems to be one of the biggest trends that we're seeing is this mixture of drugs and people not realizing what they're taking and overdosing. And then this is just a graphic to give you a little bit of information on comparison. So you can see, if you see that penny there, there's the lethal dose of fentanyl. Next to that is just that little bit of dust that you see there. So it takes just a very little bit of fentanyl to cause a lethal overdose. And so as these things are being mixed in together, it can be very fatal. And then carfentanil also there, and heroin. So fentanyl comes in a lot of forms. It comes in powders and pills and crystal forms. But the main thing here is that synthetic opioids, they're about 50 times more likely, more potent than heroin. So as these things are being mixed together, this is where we're seeing so many of these overdoses. So that's just gives you a little bit visual to kind of compare as you see drugs. And then with that, I will turn it over to Chief Jungman, who will explain a little bit more about Narcan use across the response that they're seeing, and then at the end, we can stand for questions, if that's okay.
Thank you, Chief.
Sure.
Chief B.J. Jungman.
Good evening, Madam Mayor, members of the council. Again, thanks for the opportunity to present tonight with Chief Schwartz. As you can see, we continue to see a increase in Narcan administration. So all this information is based on the emergency medical services we provide to the city. So it doesn't get into specifically what type of opioid. Chief Schwartz has more of a handle on that. The EMS system doesn't necessarily document which opioid. We just document the signs and symptoms and treat for that. So as you can see, since 2006, which we have records back to, the amount of Narcan we're using is significantly higher, given that in 2020 it was a little over 100, and in 2021 just under 100 administrations of Narcan. So a significant increase. Then we look at the primary impression. So when the paramedic gets there and evaluates the patient, when they say, well, the primary reason we're here, the patient's condition, is a primary impression. So you can also see, along with the Narcan administration, we are seeing a primary impression of overdose significantly higher. When you look back to 2006, it was negligible. We're talking, you can count on one hand how many overdoses we were seeing in a year. And over the past 2 years, it's been at least 50. And again, sometimes that's just the primary impression. There's many times that we show up there for other emergencies, whether it's psychological emergencies or other things, where overdose is also a piece of that, but it might not be the primary reason we're there. So that's why you see the difference between the Narcan administration and the primary impression is that there may be other things going on as well as the overdose. This is a heat map of where we administered Narcan. The 2020 map is on the right and the 2021 map is on the left. And I think of note here is we don't see the heat map in the same area year to year. Where we are giving Narcan can change from year to year. So what might be a hot spot one year where we are seeing more overdoses, the next year may not be. There's a number of reasons for that. When I show you an upcoming slide, some of that may make more sense, but this is administration by the location type. So we look at what type of occupancy did we respond to. And if you look here, a good chunk of those are single-family dwellings. A good chunk of those are multifamily dwellings. But then we also have a disproportionate amount of hotel and motels. So we have a lot of transient population that we end up seeing these overdoses. That's more disproportional than we see of the rest of our community. So those are the big three buckets where we give Narcan and see opioid overdoses: a single-family, multifamily, and our hotel motel community. So then looking at time of day, you can see that Narcan administration happens throughout the day. I think there sometimes is an idea that it might only happen in the twilight hours of the day. Overdoses are happening any time of the day. And as a matter of fact, 6 p.m. is just as crucial, or happens just as often as midnight in this case. The same thing with the day of the week is we are seeing this every day of the week. It's not just a weekend problem. It's not just, like I said, certain times of the day. Monday is just as busy for overdoses as Friday is. Then we start to look into demographics of who are we treating and what is their gender and age. And you see that there's a greater proportion of males in the mix of opioid overdoses or Narcan administration. And generally the age range of the greatest amount is 20 to 39, but that doesn't exclude the rest of the population. That's just where we see a greater amount of that. So in summary, from Chief Schwartz and I's perspective, is the drug use and the overdoses can impact the overall public safety of the community. It impacts a lot of our community. There's not one initiative to the answer. This is a difficult and challenging issue, and we believe that response should be unique to the community needs. There's a lot of facets to this. It's like we said, there's no one silver bullet to fix the problem, and it's something that we stay attuned to and continue to look at trends and try to do everything we can to keep the public safe and make sure that we're ready to respond and help people to the best of our abilities. So, turn it over to Chief Schwartz. If he has anything to add? Otherwise, we'll stand for any questions.
Okay. Questions? Councilmember Gustafson.
Chief Schwartz, does our behavioral health unit get involved in these situations where we have the overdoses and that and do the follow-up and work with the county
They
social
do.
workers and that?
They do get involved in some of these cases for those reasons and depending on the amount of resources, but yes, they are in tune with what's going on.
Thank you.
Any other questions? Councilmember Keeley.
Since Burnsville as a city is not involved in addiction treatment or support programs, that's primarily the state and the county and a lot of private agencies that do wonderful work in that area. This money from the lawsuit, how would you be able to use it from your perspective, given the limitations on what it has to be spent on, which is what we don't do, quite frankly, but so we would become an intermediary for another agency to take the money. We wouldn't. But in your case, because you do, in answer to your last question, have in our behavioral health unit work with those circumstances, how would you be able to spend any of this money internally in PD and fire?
I mean, I think it remains to be seen, right? Because I don't know every circumstance for which the funds can be used, so it would definitely take resources and time to sort of sift through that and determine what it is we can do. As you know, public safety takes on a lot of initiatives or gets involved in a lot of initiatives that aren't necessarily a public safety piece, but it's a public health concern or crisis, similar to what our behavioral health unit does. So I think I don't know the answer to that. I would just say we would be looking at that from how collaboratively could we work with our partners in Dakota County, just as we do on other crises that we have.
Yeah, I would agree. It would take a partnership. I don't know that any of us are positioned to launch our own program specifically targeted at opioids, and I'm not familiar enough with the restrictions on the money to know how broadly it can be used, so. But I don't think that we'd be able to stand up or have the resources to stand that up alone.
Thank you.
One of the things that, chiefs, that I look at when I look at your reports, there's overtime, and with the behavioral health unit, there's a lot of overtime. So we don't know, is what you're saying, how this money can be used. But if we did opt into the settlement, using it with regard to overtime would be helpful, will it not? If it's an allowable use of the settlement.
Right, it depends on, yes, I mean, always we can utilize overtime to do additional work that we need to do. It becomes a matter of the resources of personnel staff that can work the overtime or, have the ability to do that and to train people into whatever capacity that might look like.
The other part is looking at our Dakota County Drug Task Force. And I know that task force is always very busy with the work that they do across the county. And how many officers do we contribute to that task force?
Right now, we have one. We used to have two in the past.
Yeah.
We have pulled back those resources over the last several years, but we have one agent or one officer that is an agent with the Dakota County Drug Task Force.
And that's because of budgetary purposes that we pulled back and only have one that we contribute to the task force.
Yes, because we need the staff to run operations here in Burnsville. So we always have to be taking care of our Burnsville community first,
Yeah.
and then we will collaborate as much as we can outside of that.
Yeah, especially when looking at your graphs, that the increase in Burnsville in 20 and 21 has been quite a bit of an increase.
Yes.
Okay. I think I'm going to have to ask some questions afterwards then with regard to, and perhaps I'll ask that question to our attorney, and I know that the Attorney General's office has some people here that can also answer some of the questions with regard to the use of funds. Mr. Jamnik, what do you understand from the settlement agreement?
I would like to ask my partner, Jared Shepard, to address that. He's much more attuned to the actual terms of the settlement.
Okay,
Sure.
Yes.
Madam Mayor, members of the council, with specific regard to public safety, law enforcement, fire, there is provisions for first responders within the settlement agreement. So in the memorandum of agreement, that's the State-Subdivision agreement, there is an Exhibit A that has it's about 13-page list of potential expenditures that the city could use the money for. And on page, let's see here, 11 of that, there's Section I, First Responders, and three things to point out. Law enforcement expenditures related to the opioid epidemic, education of law enforcement or other first responders regarding appropriate practices and precautions when dealing with fentanyl or other drugs, and provisions of wellness and support services for first responders and others who experience secondary trauma associated with opioid-related emergency events. There's also provisions for leadership planning and coordination that are expenditures that the city can spend money on. And of course, the exhibit and the list is just, it's not exhaustive. It just has to be related to the opioid epidemic, and it's not designed to sort of necessarily prescribe creativity in trying to respond to the opioid epidemic. But certainly if you fall under one of the three that I listed, that would be a requisite expenditure.
Okay. I know that a lot of folks are concerned about taking the settlement and what would that mean to those who are suffering with chronic pain. Will they still have access to the medication that they need to manage their pain?
Well, and I think I mentioned at the last council meeting, there are certainly provisions as part of the overall settlement to tighten up some of the practices and tighten up some of the monitoring between the manufacturers and the distributors to make sure that opioids aren't being diverted or, overprescribed. But they're still going to be able to be used by medical professionals and people who need them. And certainly, some of the folks from the AG's office might be able to speak more to that as well.
So they will still have access, just like tobacco, when the tobacco settlement took place. People still have access to tobacco today.
We aren't really going to equate tobacco and
No.
pain medication, are we?
No, all I'm asking is that it's these settlements that we're looking at and the access to the product. So, yeah.
Well, Mayor and Council, I think I would just say that the settlement doesn't stop,
That's-
the ability of doctors to prescribe opioids.
Okay, that's exactly what I'm getting at. The doctors will continue to prescribe.
Yes.
Okay, all right, very good. Any other questions for our police chief or fire chief? Okay. Mr. Lindberg and chiefs, do you know if Dakota County has opted into the settlement?
Madam Mayor, members of the council, our city attorney just kindly verified that they did
Okay.
opt into the settlement.
Okay, so the county is opted in. Our task force, our drug task force is all about that kind of work as well. Okay, good, thank you. This is really wonderful to have all of you present to give your thoughts about what is before us this evening. So, one of the things that we have in our chambers are our values. And we're really, really appreciative that you're here to share your thoughts with us. But we'll also want you to practice mutual respect for all of us. There are different points of view, and let's find the path forward with regard to this particular settlement and make sure that those who are suffering with chronic pain have access to the medication that they need. So first on the list, I'd like to invite Ms. Cammie Lavelle to the podium. Yeah, yes. And we have a seat. We understand that you have,
Can you sit here?
oh, please, yeah, so if you pull it forward, then you can be in front of the,
There you go.
okay?
And anything you place here, the council will be able to see. Ooh, it's fine, don't worry. Okay.
And then give us your name and address for the record, please.
Okay, well, let me get on the chair first.
Absolutely.
I'm vertically challenged.
Okay.
Thank you. Okay, my name is Cammie Lavelle, and what else did you want from me?
Your address for the record,
My
please.
address, I'm not a Burnsville resident, but I'm an activist and advocate for chronic pain and tractable pain. My address is 16935 Fieldcrest Avenue, Farmington, Minnesota, 55024. But it's actually, I live in the city of Lakeville.
Welcome.
Okay, thank you. I appreciate the opportunity to speak here, and thank you for the Burnsville City Council members for actually reading the documents that you were provided with. And I will say briefly that I did talk to the city of Lakeville, And can you hear me?
Yes.
Okay. And one of the council members actually had not read the memorandum of agreement and did not know what the CDC guidelines were. They hadn't read it, and they had voted yes. So it was concerning that there's some councils that are signing off on things that they haven't performed due diligence and not even read the document. I did talk to the city I am in. The reason I am here is I'm an advocate on a national level and a state level. There are advocates in Burnsville. There are pain patients in Burnsville, whether it's chronic pain, intractable pain, palliative care, cancer. They're afraid to speak up because of the stigma. They're afraid to lose their job because what is happening is opioid medications that are legally prescribed to people for medically necessary, legit reasons are being kind of grouped in with opioids that are illegal, or misuse of a legally prescribed opioid that was prescribed to someone else. So when you say opioid, and there's some people in here that might not know that heroin is an opioid, and the illicit fentanyl, synthetic fentanyl, thank you for your presentation, is an opioid. Methadone is an opioid. And so all of those opioids, when we see the deaths, which are tragic, and there is an overdose crisis, I am not saying there's not. But I would like people to understand that we need to differentiate when we talk about opioids, because I can tell you I have had conversations with people who are not looking at the data, and they're telling me that everything is a prescription opioid, and everyone who's tragically dying from an overdose are pain patients, because they hear opioid, they see a bottle of pills, because the media likes to do that, let's just be honest. And so they are conflating. And so in the graphs and the charts, which I applaud you guys for doing that, and I applaud you for all of your work. It is an illegal drug crisis that we have right now. Now, how we got here, I'm not saying prescription opioids weren't involved. But the reason I'm sitting here right now talking to you is because I am a rare disease patient. I have 3 rare diseases, incurable, no FDA-indicated treatments, no FDA-approved treatments. They involve severe intractable pain. Now, intractable pain is not in the CDC guidelines for prescribing. And intractable pain is not in the Minnesota guidelines for prescribing. And there is an actual intractable pain statute in Minnesota, which is a law for people who are not aware. But it was not cited. It was not cited in any of the guidelines in Minnesota. And I'm going to place a document here. And I don't know if, can you see it?
Yep.
Okay. This is the McGill Pain Index. I didn't create this. There are doctors who created this from McGill University. Now, what I have, the worst diseases that I have is CRPS. It's complex regional pain syndrome, also known as reflex sympathetic dystrophy. I have type 2, which is kypsalgia. Now, if you look at this pain graph here, it's rated higher than amputation, natural childbirth, non-terminal cancer, fracture. I mean, there's so many other things, but I really want you to look at that number. And anyone who's had a child that hasn't had an epidural, imagine having that pain every day, 24/7, and not having any type of pain control. That is what's happening. And the reason I'm here today is because in the memorandum of agreement, which is in part 2, under the prevention. I am specifically here for 2 reasons. Part 2 in the prevention, on a portion F. The language in here, although I believe there needs to be things done to prevent overprescribing and ensure appropriate prescribing and dispensing of opioids. I do believe that, and I support that. But the language in here, 1, which is funding medical provider education and outreach regarding best prescribing practices for opioids consistent with the guidelines for prescribing opioids for chronic pain from the U.S. Centers for Disease Control and Prevention, including providers at hospitals. And then it says academic detailing. The CDC guidelines came out in 2016. And ever since the CDC guidelines came out, doctors have been scared of the DEA. They've been scared of their state, their boards, and now in Minnesota, it's the medical boards and it's DHS. And Minnesota created their own guidelines based off the CDC guidelines, which are actually being revised right now. And the CDC guidelines were so problematic that the FDA had to come out with a warning for doctors not to abruptly taper their patients, because patients were being abruptly tapered, they still are, abandoned. They were going to the street for illegal drugs, turning to alcohol, and putting a gun to their head. This is still happening, and it's happening more. And so the CDC finally, after 3 years in 2019, put out a clarification. I know this will be addressed from some other folks, but they put out a clarification. However, it wasn't strong enough. Minnesota acknowledged the clarification that they were not supposed to mandate a predetermined dosage, which in Minnesota, they deem 50 morphine milligram equivalents a high dose. And then 90, they deem that extremely high. Now, the CDC guidelines is what started this. They were never meant to be mandated. 36 states, I believe, adopted their own guidelines. Minnesota did. They used the CDC guidelines. And Minnesota physicians started tapering their patients solely based on recommendations and these guidelines. There are physicians who have the board come after them, insurance come after them, their medical malpractice insurance companies are saying you get your patients down. It doesn't matter if they're on palliative care. I'm on palliative care. That's before, I'm not actively dying, it's for a serious illness and symptom control. And if we go back to this graph here, that's only one of the things I have. And my physician was being threatened. And I've talked to numerous physicians who are being threatened. And they're told if you do not taper your patient down to what's in these guidelines, you will be decredentialed, you will be disenrolled from being a Medicaid provider, you will be sent to the OIG, which is the Office of Inspector General, you will be under investigation, they could be charged civilly, criminal, and this all has to do with the CDC guideline morphine milligram equivalents. So that is one of the reasons I am here, because the language in this memorandum of agreement citing the CDC guidelines or something consistent as best practices is deeply concerning. I've actually met with the Attorney General's office and expressed my concerns in 2019. I've spoken to legislators that are in this room, and we're going to speak again about this. But there's cancer patients. There's people actively dying. My aunt was denied medication at Mayo Clinic. This was 2019. The oncologist said, "We have an opioid crisis. I can't treat her." I stood up from the wheelchair I was in at the time, because I was in really bad shape then. And I stood up and I said, cancer is exempt. So what are you going to do to treat my aunt? She's actively dying. She has terminal cancer. And 20 minutes, they did. But what if I wasn't there? She'd been in the hospital for 2 weeks. This is the Mayo Clinic. This is happening at every single, even pain management, and they weren't even part of the CDC guidelines. But Minnesota addressed their targeting. And we need to pay attention to this population. And I can tell you, I've been advocating since 2015. Here we are, 2022. And prescribing rates are going down significantly Overdoses are going up. What we're doing to try to solve this crisis is not working. And the people who have a medical necessity for these medications, including myself, are being negatively impacted. And the CDC guidelines is causing this. And then it trickles down to the Minnesota guidelines. And then there was an opioid work group who was supposed to protect us. Again, I'll go back to this. That's intractable pain. That's a rare disease. We're not mentioned in the guidelines anywhere. There was no support representation. There was no one from the rare disease community, like national organizations of rare disorders. Although in November of 2018, Tim Boyd, who was the national state policy director, was at that meeting in Minnesota by my request. He offered assistance because rare disease patients, we have no cure. There's 30 million of us in the United States. There's no cure. We have to go on FDA indications for pain. And treatments, since they're not FDA indicated, insurance doesn't pay for. So we go through all these treatments, all these injections. Nerve blocks made my disease spread. So it started in one arm. Get this, carpal tunnel surgery. That's how I developed a rare incurable disease. The amount of pain that I go through when not properly medicated, I can't even fathom myself. And I've been tapered, and I lost my breakthrough medication in April of 2019. Oddly enough, it was a day, less than 24 hours after a segment on KARE 11 aired, when I was speaking out about the CDC guidelines and how Minnesota was not protecting us. Less than 24 hours, I lost my breakthrough medication. I'm on palliative care. I'm exempt. Minnesota Department of Health knew, Department of Human Services knew, the Attorney General's office knew, Governor's office knew. I made my voice known. The Commissioner of Health approached me personally, said, I'm concerned about you, we'll do something. That was in May of 2019. January 2022, nothing. Rare diseases aren't protected, intractable pain is not protected, chronic pain patients are being tapered solely to meet these morphine milligram equivalents, MMEs, in these guidelines. CDC is harming patients, and the language in here, if it is kept in there, is going to continue to harm pain patients. They need to be part of the conversation. I know people who've killed themselves. I know people who actually went to heroin and had to go to Hazelton. 30 days. I know a lot of people in that situation. I tell them to seek help. Okay? So we need to be part of the conversation. And in this memorandum of agreement, although I understand there's an overdose crisis and addiction crisis, we need to differentiate and we need to be truthful and honest about what's causing this. And I am not disparaging anyone who's lost a child, a family member, who's had substance use disorder or opioid use disorder, any type of addiction, because that can happen. But you see the dots that they had put on the screen. I looked at the data myself. I can guarantee you those aren't all pain patients. And we are being grouped in to sorry, I'm getting upset. I have been told that I take heroin pills. And I will, full disclosure, one of the individuals who I greatly respect apologized to me on that. But there's about 10 other people who said it to me and have not apologized. And these are people who are creating policies on our opioid work group in Minnesota. This is who we're letting create policies for people like me. We weren't even given a seat at the table. So there's CDC guidelines. That language in there is dangerous. It's already harming people, including people in your city. Your prescribing rates are going down, which some of it is good. But But who's looking at the patient impact and outcome? Who's monitoring the people who've been harmed? And when the Minnesota guidelines came out, based on the CDC guidelines, which were not to be mandated, and that's been made clear by AMA, by the CDC themselves. Minnesota guidelines came out in 2018. Dakota County prescribing rates from 2018 to 2019, I believe someone else is going to show you that because my computer crashed, sorry, 50% drop. 1 year, 50% drop. So if you guys don't understand how the guidelines are working and negatively impacting people, please, please talk to somebody who does. And please help the community who actually requires these medications to walk, to do dishes, to go to the grocery store, to continue to work. The other reason I'm here, and I'd be glad to answer any questions. I have a lot of things printed out, but the other reason I'm here is the PDMP, and this is also F5, supporting enhancements or improvements to prescription drug monitoring programs. Now, I believe that PDMP is a good idea, but it's also being weaponized. And so how are we going to take back control? There's data mining going on. They are targeting physicians. There's reports. And they go, what is it based on? Morphine milligram equivalents. What does that go back to? The CDC guidelines, Minnesota guidelines. So doctors who prescribe to patients like me are being threatened, even though I'm exempt, and even though there's a law that protects them, but it's not cited in the guidelines, so no one's paying attention. And DHS is threatening providers who treat Medicaid patients. And they didn't even exempt palliative care. It's exempt in their own opioid prescribing improvement program, but DHS refused to exempt palliative care for Medicaid population and Minnesota care. That's a vulnerable population on top of a pain patient. And the PDMP is being weaponized. If it's used properly, it can do good things. You can monitor, you can track the prescribing, you can make sure someone's not doctor shopping. But let's not weaponize it. And let's make sure that there's more specific language in here on how we're going to use it, and also put language in there on how not to use it. Because it's harming physicians, and it's harming people like me, and it's harming people that are actively dying right now. So, I'm going to say a few more things. I'm struggling today. And if I do too much activity, I have pain flares. And again, as I indicated, I lost my breakthrough medication. Breakthrough medication is when you do have a pain flare. And with CRPS, I have them every day. But my regular medication, which I still have access to, controls the majority of it. But when I go from like a 5 to a 10, my 10s are screaming to the point I can't talk. And my husband has to help me bathe, has to bring me my medication and pour water down my mouth so I can take it. If it's time for my medication, if I don't have it, which I can't ask for extra because I'm already deemed a drug seeker, and my doctor will not prescribe over even though he legally can. I am going into a flare right now. I probably shouldn't have come here. This is not any made up stuff. This is my life. And there's tens of thousands like me in Minnesota, and we need to talk about them. I'm going to make one more, couple more comments here because I know my time's running out. But I would like to also clarify something here, because there's some people who don't understand the difference between illegal opioids and medically prescribed opioids taken by a pain patient, okay? This is from the Minnesota Department of Health. and this is the 2019. I'm specifically going 1 year because it's the easiest one to go off of. And I actually had a spreadsheet, and I had computer issues, so this is what I can do. Now, I will put it on here so people can see it. And if I'm going over time, just tell me. Okay, we can see that in 2019, there was tragically 413 opioid-involved deaths. That's 413 too many, I agree. Absolutely agree. Let's look at these numbers. Synthetic opioids, which is mainly illicit fentanyl, the illegal fentanyl, not prescribed fentanyl, okay? 298. And out of that 298, and I don't have the sheet again, but someone else does, 288 of those were deemed to be the illicit fentanyl. The rest could have been tramadol. Let's go to the heroin, also an opioid, 102. So we have 413 opioid-involved deaths. Between the synthetic opioids and the heroin, that totals 400. So we know 400 had synthetic opioids or heroin or both. Now, in addition here, they have methadone or other opioids, 136. Now, these categories are not exclusive. So for people who are not familiar with this data or these charts, when I say non-exclusive, if someone had heroin in their system, cocaine, and a commonly known prescribed opioid, let's say it was tested for oxycodone, they had those three in their system. The way that the Minnesota Department of Health describes it, if you read their information, it's counted in each category. So someone could have a commonly known prescribed opioid or a prescribed opioid. They could be a pain patient, but also taken heroin and had illicit fentanyl in their system. What did they die of? It's tragic that they died. I'm not discounting that. But do you think it was the one pain pill that killed them? Or do you think it was the heroin and illicit fentanyl or cocaine? We need to have better data. We need to differentiate. We need to attack the problems. We can't put 95% of the focus on 5% of the problem. So if there's any questions anyone has on data, anyone has questions on any other diagnosis I have, what other treatments I've tried, what treatments I can't have, the $22,000 infusion, per infusion treatments I can't afford that insurance won't pay for, injections that made my disease spread. I could talk for hours on this, but I know it's time to stop.
Thank you so much, Mrs. Lavelle, for telling us your story and also saying that there are things that can be done with regard to the settlement, and that there are some issues within the settlement that could help you and others who are suffering with chronic pain. So there are folks here tonight from the AG's office and from the Department of Health from the state. So my hope is that, the issue is not whether we accept the money, the settlement. The issue is how we solve the problem that impacts you. You need the medication and others need the medication. So how do we get at that solution? And so I thank you for being here this evening.
Well, thank you for that, and I had asked, due to that specific language on the CDC guidelines and the PDMP, since it's not protecting people and people are being harmed,
Yeah.
I would ask the vote no.
Okay. Thank you.
Any questions from anybody?
No, I think
No,
you.
and just to clarify, your ask is not that we accept the money and do something with it. Your ask is that we do not accept the money because you find the language in Section F to be dangerous and harmful to patients, and you have experienced that exact harm.
Correct.
Thank you.
Okay. Thank you, Ms. LaBelle. Our next speaker is Representative Dave Baker. Mr. Baker. Thank you for coming in this evening.
Thank you, Madam Mayor. Council members, thank you so much for your reconsideration. My name is Dave Baker. I live at 4490 15th Street Northeast in Wilmer, Minnesota. I am a state representative, a small business guy, and I think like a lot of folks here in the room, I've been affected horribly by this horrible opioid epidemic that started with a company that tricked the medical community. Plain and simple, they told people this was not addictive. They coerced our FDA, and there was a string of horrible miscalculations and misuse and bad players that led us to where we are today. I had a beautiful son, Dan, who died 10 years ago, and that's kind of what has been driving me in the state legislature to work with other colleagues of mine that are here, and I'm so grateful for their help. And a couple years ago, we passed a bill that is, we raised the price of licensing for pharmaceutical companies in Minnesota, the first in the nation to do that. We've raised, each year, we raise about $14 million that specifically goes towards helping our state and counties with programs and helping with addiction services and medically assisted treatment and bringing Narcan to our police officers and our police chiefs and our fire departments and so on. We are only 2 years old. It's very new. I am currently the chair of the ORAC group, which you might have heard before, the Opioid Epidemic Response Council. With that, I have been very involved with the discussions with the AG's office over the past really 2 years, 2.5 years, when Attorney General Keith Ellison called me and said, hey, I think I got great news. I think we're coming to a place where we are starting to find some agreement that we are going to see some big dollars coming to Minnesota, and this is exciting times. I think we can really get moving on this thing, and they're wanting us to sign off on this thing, and blah, blah, blah. It was 2.5 years ago. I remember exactly where I was at when he called me. I'd never talked to AG Ellison ever in my life before that. And it was a time I won't forget, because I just said, okay. And he was pretty excited about it, and I've shared this with him before, and I said, here's the deal. I don't care what the money is. I don't care about any of that. What I care about is finding out what in the heck happened here. How did we ever get to this place where all these people are dying and folks like Cammie that was here have been hurt because of doctors that were told they could freely sort of prescribe these medicines without that fear that they likely probably had, because they were told it was not addictive. And then there's been retraction from docs that now are scared to hurt people and hurt patients. Just like my doctor that prescribed to my son, he left the profession a year after my son died. I don't know if exactly what it was for, he was not that old, but he knew that his patients were needing more and more to get that same relief they first got. So we've got ourselves to a place here, folks, that isn't good, it's not healthy, but this settlement is a starting place. And let me just, before I go back too further, I got a little distracted there. The Attorney General, during that first conversation I had, I was sort of abruptly angry that don't you dare settle on any of this until we get full disclosure about what happened. And there was just this long pause on the phone. And I think ever since that moment, he and I had this connection about we are going to try to do something good with this without trying to spike a football, without trying to think that we just scored big because we're hurting a bunch of companies. That's not the intent of this. We have to find out what happened, but this settlement that's being presented to the city of Burnsville is one that 87 counties out of 87 have said, yes, we're on board with this. The last 4 or 5 months, we have been in meetings intensely because there's a deadline coming up, which is tomorrow, February 26th, that we get to in the state of Minnesota to say who's in and who's not. Cities over 10,000 population, all of them, every single one of them, have said yes to this point. Burnsville said no initially, and I'm happy that you're reconsidering this tonight. Thank you for that. I think that what we have really worked hard on in the last 4 or 5 months is getting through these questions that people have. hearing the concerns about how do we best deliver these services to our people on the ground. So we're taking $296 million coming to Minnesota over the next 18 years. In Burnsville, that's a little over $1 million. If Burnsville says no, it'll cost us about $1.8 million for the rest of the state because of a bonus triggers that kind of come along with it. Because we're going to tell them, we're not going to come back and sue you guys, these particular companies for this again. We're kind of writing off our future rights. And so we agreed that this is the best deal we can get. And it's amazing that the Attorney General's office have really done a good job on this issue, getting this communication to the League of Minnesota Cities, the Coalition of Greater Minnesota Cities, the Association of Minnesota Counties, which have really sort of been a driving force to communicate this quickly around the state of Minnesota to get all of our elected local officials on board. And for that, I'm very grateful for this movement. Again, this master national agreement is not perfect. The work that we do in Minnesota can certainly get better. We have problems that we have to still deal with. Underprescribing is a problem. I do not want to see opioids go away at all for medical reasons. I disdain the people that are trying to kill us with fentanyl in these drugs. And we need more tools for our police officers to get those folks out of here. I am so angry, and I've lost so many other people in my area, my community alone, from fentanyl. This is ridiculous, and we need to really support our police officers and the BCA and the folks that can actually stop this madness. So I'm really here tonight, Madam Mayor and council members, to really answer questions. The part of this with the CDC guidelines are just that, they're guidelines. The state of Minnesota can do our own work. We need to continue to work with this. We are not going to give up on our friends like Cammie to say that we are just going to say, oh, this is okay. No, it's not. But it's complicated. Opioids are very complicated, and pain is complicated. And we have to have a lot of sympathy for Cammie, because she deserves that. She has fought since the day I arrived in St. Paul. And people like that need to hear from us, and we need to do better for her and others. So again, Madam Mayor and council members, I'm here to answer questions. I am so grateful that you're reconsidering this, but this does not hurt doctors in what they're going to do to prescribe these things. It will bring valuable resources to the city of Burnsville to help with child protection services in the county, which it already has done. Law enforcement, workforce, people in this area, child education and prevention. What we learned from the tobacco industry was that we're not going to just put it in the general fund. And there's only certain things you can use this money for. This is something that we can do good with, and again, I stand for questions. I can be called back up. Thank you for the reconsideration of this, and happy to take any questions, Madam Mayor.
Representative Baker, thank you so much for making the trip, because I know this is very important to you, and that you too have suffered because of the loss of your son with regard to opioid. And I'm sorry for your loss. And I know it probably, as a parent, it continues to pain you each and every day. And so I really appreciate that you also mentioned Mrs. LaBelle and what she is going through. Let me ask you this. She says that she's not at the table. Could your opioid response council have someone like Mrs. LaBelle at the table, that her voice can be heard when we're looking at how we will do things in Minnesota with this money?
Madam Mayor and council members, absolutely. I think all of our meetings are public meetings. We have a public session twice in every one of our meetings. There's 19 seats on this, and we have a person on the council that's specifically to chronic pain. The process of getting certain people on there is a process under DHS, and through the process they apply for these open seats. So when there's an open seat, we advertise that.
Yeah.
I think having somebody like Cammie would be great, because she's a very strong voice in this area. So again, we've got addiction doctors, we have people in chronic pain, we have folks from the Native American community, people with loss, people in current recovery with opioids. We really, I think the group of 19 are real folks with boots on the ground all around the state of Minnesota who know this issue. Again, we're still only 2 years old, but we're learning how we should be. And we are learning all the time. We're open to even adding seats with legislation. So that has to go through that process. And it's not easy to do, but every one of our meetings are open to the public. The minutes are posted. There's a website. We're very, very interested in hearing from everybody.
Thank you. And I like the fact that you acknowledge her and what she's going through. Thank you. Councilmember Schultz.
So you did mention that Burnsville is the only city so far that has said no, and that is true. I have, since we had taken our vote, I have been contacted by other cities, mostly because they said it was on their consent agenda. They didn't even read it. They got information from their city manager of, here's money that you can have, and you just need to vote yes. And so they put it on their consent agenda, and they didn't even examine the issue. We did examine the issue. We had 2 meetings on this already. We did take our vote. We have since had other cities contact us back and ask us for more information, and they are taking a closer look at it. But I will note that when the League of Minnesota Cities was holding their Zoom webinar discussing this settlement and why Minnesota cities should take part of it, one of the pieces of information that they put out, and just so you're aware of what information was put out, was that the overwhelming majority of overdose deaths in Minnesota are prescription deaths. And we all in this room know from our presentation, even just from our police, that that is wrong. So our cities were given absolutely, utterly incorrect information to make a decision on by League of Minnesota Cities. And I'm pretty disappointed with how that presentation went down. It should have been a better, more truthful, thorough presentation so that cities could examine this issue. So I did want to make you aware of that. It's good that on that Council of 19 that you're having a chronic pain patient on there. But I will tell you, the history of the state of Minnesota has been to utterly shut pain patients out and pain doctor specialists out. In 2015, when the Minnesota Opioid Work Group was formed, there was no chronic pain patient on there. There was no pain management specialist doctor on there. The 2 key stakeholders were shut out on that. And through serious lobbying efforts over years, finally in 2020, legislation passed and they said, okay, we'll do that. We'll let you have a seat at the table finally. But there's a catch. One was someone who actually applied to be a chronic pain patient and be that advocate. The other person who was accepted as a chronic pain patient was someone who applied to be the addiction advocate, but had mentioned that they had taken opioids as a pain medication, and so the work group said, close enough. Here's the real fun part of that. They never got to vote, and that group has since been disbanded. So when we look at this memorandum of agreement, we're being asked to trust the state of Minnesota that they will not do these actions in a punitive manner. And that is following on those CDC guidelines. It is really clamping down on medications, which, as the attorney mentioned, yes, they're looking at further restrictions. Like that, flat out, they're looking at further restrictions. And they're looking at increasing monitoring as well, which is happening to the doctors. So when you're going to say, trust me on this, Representative Baker, and the past actions do not show a trust relationship, that makes it really difficult. And I know you can understand that. And since you're standing there, I'm gonna hit you up on something. So we do have legislation, and I'm sure you're very familiar with it, and it's from one of your colleagues. And this bill is going to be going up in front. In fact, it's Representative Bierman who is authoring this. And this is specifically a bill for intractable pain. This bill has gone before Minnesota every single session for years, and they can't get a hearing. Would you, sir, champion this?
Representative
Yes.
Baker.
Thank you for the question, and I am visiting right now with Representative Bierman on this exact issue. We have a meeting on this next week. So this is an important issue, and it's a very challenging conversation, but I absolutely will jump on this bill when I have more time to talk about this with the representative who's actually into this conversation more. As I mentioned with you on the phone too, we have to get this right. It's complicated.
Yes.
And anything we do in the state of Minnesota takes forever to get through. And so we've got to take this recoil back from the docs that are kind of saying, whoa, 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 what am I doing here? They're walking away from their patients. You're right. But we need people to trust. We need some of our elected officials to trust others like me and the AG's office in this case to do what's right today for this thing. But we will not say that we're done. We ain't spiking no ball here. So we have to do this right. We need Burnsville to join us. And that's what I'm asking you guys to do tonight is, it may not be perfect, but we will still fight for folks like Cammie and others because they deserve people in St. Paul fighting for that too. Nothing right happens in federal CDC anyway, right? Come on, we can do this better at home. And I'm committed to helping those kind of issues. So I really do hope that we can do this right tonight.
So I teed up a softball for you because I knew that you were meeting with Representative Bierman. And I do appreciate that.
Thank you.
My concern is, and this has nothing to do with you personally, but my concern is the past behavior of the state of Minnesota has shown itself to be hostile or indifferent to pain patients up until this point. So we don't have a trust relationship on this. And yes, was Burnsville standing alone, and hopefully we'll still stand alone? That may be the case, because sometimes when you stand up for something that's right, that means you are going to stand alone. And you need to do that, and you need to bring light to a situation that is screaming for help. So I do appreciate you coming here. You had a little bit of a jaunt, and it was not a warm evening.
It's a nice drive. And Councilmember Chu, again, I hear you loud and clear. I don't think I would choose the words hostile. We have more to learn, and we could do better. But we have always felt, my colleagues in the state and the DHS and the Minnesota Department of Health, we care about Minnesotans, and I think that we have learned a ton, but I don't think we've ever been hostile. We have never tried to shut them out. We didn't understand it. And I think there's a difference there. Ignorance, sure. And I think when you mentioned the league, they made that statement in their video Zoom conference. I didn't see it, didn't hear it. I heard it for the first time from you. Here's what I think they meant to say. 80% of folks that are dying of opioids today, whether it's fentanyl or overdosing and heroin, started with prescription drugs. They didn't intend for that to happen. But 80% of the folks that started on any opioid started with a pill that was likely prescribed to them, or they shared it with somebody at a party. So again, part of that problem is misuse ahead of time. But I think that's what they said. I wasn't there, so again, I apologize if I have it wrong, but that is clear information that we have looked at for years. So further questions, Madam Mayor?
Yes, Councilmember Keeley.
Thank you, Madam Mayor, and thank you, Representative, for coming out. How can this settlement stop the interference of doctor-patient relationship in managing chronic pain?
How can this stop the interference? I think this bill has a lot of resources coming towards it for a lot of different things, whether it's law enforcement, education, prevention. I will tell you that doctors in training, doctors with continuing education credits that have to do this every year, I can see dollars going towards that to make sure that doctors do a better job in understanding when you prescribe for the first time, the difference between acute pain and chronic pain, when you shouldn't do an opioid out of the gate, but also then when a patient is edging up and you're concerned about the MMEs getting too high, that was mentioned earlier, here's what you do to start turning it down, but it's extremely careful, it's extremely slow. It has to be thought up over time because you don't do this when somebody comes in every 30 days to get their next prescription to say, oh, by the way, we're going to taper you down. That's an immediate mental reaction that is not good. And so I hope with this resources that's coming to Minnesota, of this $296 million, that we in the state can do a good job teaching the folks that will understand pain better, the folks that have the prescription pads in their hand will understand how to do this better and never run away from their patients. I hope that they understand that we have to teach them better to not fear this and not fear that they're going to get in trouble because they're trying to help their patients. Again, as Cammie described tonight, doctors have done that. They have ran away from their patients, and they should not have done that. And we weren't ready for that reaction as quickly as it came because we were putting them on a report card. We were going to say, you're in the top 20% of your group, of your discipline group in your medical field. That's not right. I was concerned about this for a while. Now, we had to make sure we found the ones that were way out there, but there should have been a very careful approach to how we then approach those prescribers, and I think we haven't gotten that right yet. So we're working on that. In my opinion, we can do better, but the doctors and the world of our medical conditions in Minnesota and the prescribing habits that they're doing is so much better than it was 10 years ago and 15 years ago. It's better. And for that, I really applaud the medical industry around here for listening to us and doing a lot of things internally. So that's what I think can happen with that, Mr. Keeley.
You had mentioned that you're going to introduce a bill and you're going to meet with the other representative on that bill. But is there room in those bills to put language that can fix what is in the opioid settlement that is inaccurate and, absurd? Statements like opioids should not be used for chronic treating pain. It's kind of like the dumbest thing I've ever read in a lawsuit is the number one drug for treating pain is not to be used for treating pain. I mean, how did that garbage get into this in the first place? But it's there. So what tools do we have to be able to offset that or fix that in the legislation that you're working on or the ones that have been attempted for the last several years?
And that's a great question. I think that the legislation that I'm working on is going to be narrowly defined about this statement and or this agreement to make sure the agreement from the counties and the cities, 75% will go to Dakota counties and the other counties and larger cities. The legislation I'm working on with the authors of the original bill that got the licensing fees increased, a bipartisan group, we're working on those issues pretty defined. When we want to talk about law enforcement support on how we can get the bad dealers off the, and how we can have maybe higher and better sentencing guidelines that are more reflective of the danger and the poison that they're doing, those are on other bills and other bills that I will support and work on. The bills that are going to talk about this kind of thing with what are our guidelines here probably don't belong in the one bill talking specifically about this. This agreement, this memo of understanding, is going to about the flow of money to our counties and cities and how we are going to use that in these areas of concern or these areas of our focus. Those, again, every biennium we have 3,000 plus bills that are introduced. And of those, a number of those are medical, healthcare related and things like that. I am committed to making sure that we continue to work on that. I don't know that it belongs in maybe it's Representative Bierman's bill that he's working on with his chronic pain specifically to that, but we'll dive into that. And But nothing in this memo should be stopped because of that statement from the CDC. We can do better here in Minnesota. We aren't locked into that. I think we can do better with that.
That's a good point, because the language has some concerns that Councilmember Schultz brought out in our
Yep.
first meeting. And that language is the one I cited, and some others, is very problematic. And it becomes a critical point of judgment on accepting it or not, as Councilmember Schultz has pointed out, because it does have some bad language. And so I'm looking for any way that exists that our state legislation can essentially fix that. To your point earlier, you said we can do better. We can work on legislation that can get this fear out of the patient-doctor relationship, this fear of being reported, or this fear of giving too much out and being monitored. There's many examples, as was told, and I agree with you, and I'm glad that you made the statement that the last thing that we want our doctors to do is to walk away from a patient in chronic pain because they fear somebody is looking over their shoulder and going to penalize them for doing the right thing. There's been so many attacks over the decades of a doctor-patient relationship by oversight bodies, government bodies, insurance bodies, et cetera. And it is usually never turned out well for the patient. And that is, I think, an important point here, is we've got to make the legislation necessary and enact it to get this out of the way and allow people with chronic pain to get what they need. I only experienced severe pain once not long ago when I threw my back out, and it was a 9 on a scale of, I've never felt pain like that. And I couldn't move, I couldn't breathe, I couldn't do anything. I could just lay on my back still, and any movement would send pain shock waves through my entire body, and I thought I'd, pinched a disc, which is what I did. I just dislodged it and it pinched it, and so it went into shock, and it was just shooting pain in all directions. And for 24 hours, I was feeling what I believe was described earlier and what she feels. And it was, I just can't imagine living with that every day. And so this is not a comparison by any stretch, but when you hit that pain on a scale that you think this could have been a 10, but maybe it's not, but I can't even move. That's something I couldn't possibly imagine having to live with without some help from our pharmaceutical companies, which have done some incredibly wonderful things. They're not responsible for the fentanyl that gets mixed on the street or imported from Mexico. Correct. They're not responsible for all of those illicit drugs that are responsible for, basically, the chart we saw, 90% of our overdoses. So it's tough to look at this lawsuit and penalize those companies for bringing pain relief to people, and also point to them and say, well, you're also the problem for all of this overdose. And that connection you had made earlier, you made a comment that most, 80% I think is what you had recited, started off with a medically prescribed or gotten from a party or a friend, right, illegally, and it led to other things, and that there's some liability on the part of the drug companies who were saying, this is a miracle pain reliever, give it out, give it to your patients, there's no concern of addiction. There may be the single statement where I believe that there's some cause in this lawsuit. But there's, like I said, there's so many things about the language in that lawsuit that make no sense whatsoever, and I can't believe it even got that far, but worse things have happened in lawsuits. So, thank you very much.
And Mr. Keeley, one thing I want to say is, we're not looking at this lawsuit because they were trying to help people with pain. They've been around for 100 years helping people with pain. It's when they looked the other way. The distributors in this lawsuit looked the other way when they knew there was abuse going on in pharmacies and overprescribing, and they did nothing. They ignored the flags, and that's why we're here, is because they literally looked the other way because they were making so much money. And unfortunately, that's what got us here. Is not that opioid is not a good thing to use in our medicine. It is. When you need it, you gotta have it. But they looked the other way, and that is what they've recognized by this settlement. And I think that's what we have to understand. We need this medicine in our system, but we don't need people looking away when they know something's wrong. So, but thank you.
Okay. Councilmember Schultz.
Thank you very much. You know, I have heard that information that most of these addictions are starting with a pain medication. However, in delving into it, that is not what we have seen from addiction specialists who are saying people's first addiction happens in their teen years, and it happens with abusing alcohol, and that is over 90% of those. When people notice an addiction is when they have graduated, either they're into full-blown alcoholism that they can no longer hide, or when they graduate to another drug. And that's when we notice it, or we allow ourselves to notice it because it's at such an extent. So when we're looking at how are we getting into this mess, a lot of it is leading back to childhood and childhood encounters with alcohol and binge drinking. I do have a question for our attorney, either attorney. We have a plethora of attorneys there, out there. We're attorney rich this evening. God, there's so many billable hours going on right now. Okay, so my question is, the memorandum of agreement that we need to sign on, that is not something that we can alter. It is a yes, no. And that is it.
That is correct.
Yeah.
And so his answer was, that is correct. It is a yes, no, that is it.
Okay. But what I have hope and optimism for, Representative Baker, is that you said, we don't have it perfect, but we're going to continue to work on it. But what you need for us to do is to vote in favor of the settlement so that we can move forward, but you're not going to stop there. You're going to continue to work because there are issues that have been highlighted. And unless we continue to deal with it, the thing is, how do we continue to hold ourselves accountable moving forward? And I think that's the piece. For me, there is hope and there is optimism as we move forward with this. But the thing is, you need to stay at the legislature to ensure that we continue to work on this in a way that addresses all of these issues that have been raised by Mrs. Lavelle.
Madam Mayor, my voters will decide if I go back or not. But I will tell you what Burnsville has done is you did put a light on this. As Councilmember Schultz said, you did put a light on this language that hadn't gotten a lot of attention at all. So thank you for that. Please support it. We need you on board. We need to show the rest of the nation that Minnesota is locked together and to going to fight this thing, and we are not done with this at all. There's a lot of moving parts. Our work will never be done with this. So thank you for, again, reconsidering this today. It was well worth the vote. Well worth the drive. You have a beautiful facility here in a beautiful city. Thank you for letting me speak to this.
And I'm going to ask you to not leave, because I want you to hear what people are saying.
Yes, I will.
Because we're going to continue to work on this. As someone who is highly involved with this particular issue, I need to know that you care enough to help fix the issues that are problematic.
Madam Mayor, you had this one issue tonight. I'm staying for the whole thing. So I'm not going anywhere, and I'm also available for people on my website. I mean, I'm very accessible to people at all times about this issue. I want to hear from people. So thank you. I'll be here.
And thank you for making the drive.
You bet. Thanks.
Okay, thank you. The next person who wants to speak is Dr. Todd Hess. please come forward and
Thank you. Madam Mayor, my name is Dr. Todd Michael Hess. My address is 1 Windy Hill Court, Sunfish Lake, Minnesota, 55077. I'm actually a former Burnsville resident, though. I used to live in Summit Oaks. I'm very proud of what I saw tonight. I am amazed at what you've done to bring light to this. And I literally stand in awe that Burnsville was the one who stood up and read the language. Dan, that was incredible. She was a council member, Dan. And I have to say, I so enjoyed living here. We used to live right over in Summit Oaks, and we would probably go to one of the best dog parks in America, which you also did in Burnsville.
well, of course.
You also have Jensen's Cafe. No one else has that in the world. And you've got a beautiful art center also. So my little move to Sunfish Lake was only a few miles away, so I even more than ever want to come and support your city tonight from what I've seen by the intelligence of your council. Unbelievable. Okay, my background. I've been a pain management specialist now for 31 years. My training goes back to St. John's University, where I graduated magna cum laude in kind of a unique human arts type thing. I really wasn't the big science head. I got into medical school at the University of Minnesota. I'm from a small town called Staples in Verndale, Minnesota, from a poor farm family. I still farm in Rush City. I trained at the U of M, then I went to Mayo Graduate School. At Mayo Graduate School, I took up anesthesiology and loved being in the OR, but met some incredible Lutheran women that usually wouldn't swear, but when they had postherpetic neuralgia, they would come into the Mayo Clinic screaming and swearing at their 9 out of 10 pain, as Council Member Keeley just described. And they were told there was nothing that could be done. And with my humanistic background and my religious faith, I thought that's just absolute blarney. I'm also Irish, so I will try not to swear. And I thought, well, to hear Lutheran women from Olmsted County swear their lungs out, obviously we have a pain problem. And so I dedicated my life as ministry, really, to pain patients 31 years ago. I went on to be on staff at the Mayo Clinic and was then asked to come to the Twin Cities to build a pain program. So I've done that program now 31 years. This will be this year. I built one of the first multimodal pain clinics in the area, where we were very avant-garde back then, and we had acupuncture, and we had biofeedback, and we had a psychologist. In 2001, I added 2 social workers because I knew the social needs as you do. And once again, thank you for your work and your honesty tonight on the fentanyl, which I really appreciate, that the illicit drugs are really fueling this. I went on to do a case management every Monday that my staff is mandated to do. So a patient who has trouble with their meds, not getting enough meds, not getting the appropriate care, we meet openly and honestly like you do here tonight. We talk about the cases. It's CQI. Every 3 years, we are subjected to the Joint Commission. Now, I don't know if you cities have that, but that's when the feds come in and they roll you down. They take you. And most administrators are afraid of that. Interestingly enough, maybe in my farm background, I applaud it. I can't wait for them to come. So to show them what we do for safety, to show them what happens. And if you go online, we are a Gold Star facility. We're one of the few pain centers that actually invite Joint Commission because we're part of a large hospital organization. So we do understand safety. But unfortunately now, I've seen the pendulum swing the other way. I think we've gone from opiophilic, meaning everyone should be on, to now we're opiophobic, where nobody should be on. And I, like Councilmember Keeley, when I read the language, I just about flipped out. I said, no use of opioids? Are you kidding? I've been a victim of 18 kidney stones. I know exactly what you think. It's amazing what hydromorphone can do when you're trying to spit a 11 kidney stone out. It's pretty bad. And it's interesting for those, I think for those who's had pain, I think we're probably much more adept at answering this question of what are pain meds helpful? And the answer is yes. Can you imagine a group of cardiologists telling them that you can't use a cardiac med because it might kill someone? Well, if it's monitored properly, cardiac medications are safe. If they're monitored properly, opioids can be safe. I also believe much good has happened from this, as even Representative Baker, excuse me, sir, Baker said, that we have done good things in this state already. One thing I'm proud of is the work we did where we're now matching the opioid to the surgery. We used to just give 90 tabs for everything. We found out some people are using 4. So there's grandma having 86 pills in the counter where Junior could go. So that work, I'm incredibly proud of, and this is the things that we can work together on. This is the good stuff that happens in Minnesota. More addiction treatment. We're the addiction capital of the world. My brother had a wonderful multi-day stay at Hazelden, and he's 31 years sober. God bless you, Jeff. Limiting short-term doses, absolutely. Less pain meds in the community, absolutely. What I'm most thrilled is ways to get rid of unused meds. We used to try to go to law office. Where could we bring the unused meds? You now take them. We have doTERRA. We have products that will actually take the med back to get them out of the places they can be problematic. So thank you on that, absolutely. Also, pill mills, shut down. Thank you, absolutely. We are not going to stand up here and lie and say that we've all been doing the right thing. I believe I have, because from the minute I started, this was ministry. But not everyone thought that way. I read again about, I believe it's a psychiatrist in Florida who basically should go to prison for what he did. He sold 200 patients a day. They each got an oxy. Okay, your first visit with me, if you can tolerate me, is going to be an hour and a half, because we want to go through all your records. So maybe I should tell you what happens to a pain patient when they really do come in, like Ms. Laval's story, which almost brought me to tears because I literally see this every day of my life. They go through a very rigorous review, all medical records. By the way, we love the PDMP. That was a wonderful gift. We were waiting for that so that we can see what's going on. Had they gotten a med? It's amazing how many people a few people can slip their mind. No, I didn't get a refill. You did yesterday. Yeah. Just a nice little reminder.
Yeah.
So that helps us. We're very happy knowing that we have these safety features in place, that the patient then goes through a controlled substance agreement. We sign that with them. We've done this for years. We were the forefront of that. Urine surveillance. We actually started that with the doctors here at MedTalks in the Twin Cities. I was on one of their early councils. How can we best monitor urine? Again, to show people like Cammie that she is using her meds properly. We have pill counts. So if you call us a candy store, which I've been disparaged so many times on, how many times have you been to Kissin' Cousins Candy in Park Rapids, Minnesota, where you need to give an ID, give a urine, sign an agreement, and not go to any other candy store in the world? Obviously, we are not candy stores. And using disparaged language about us and our patients is incredibly not productive. We have to respect the people who have these terrible pain conditions. And if I can just put a plug, this film blew me away. This is called The Painful Truth. And if you want to look at something, this was Montana Public Television, and I know Lynn well, Lynn Webster. He's a pain doctor in Utah. I think if you can see what these patients actually live through, you would understand why opioids are still necessary. And you're right, Councilmember Keeley, can you imagine living that pain every day of your life? No. And then being told, get off the med because your number's too high. And that is absolutely happening, folks. Don't kid yourself. Multiple people. I have been threatened. Multiple colleagues have threatened. I put myself in jeopardy even speaking publicly to you tonight because I've been reviewed. Multiple doctors have called me. They're reviewed. Fantastic primary doctors who've done excellent work have basically been stopped in their prescribing. My solution was to say, why don't you work with the patient, and then maybe once a year let me do the check-in for you to make sure you use them properly. That was not enough. It was no. And so all these patients were left with no place to go. So they flood into our pain centers and then left, but yet then we're scrutinized. Even though the CDC guidelines stated specialists were exempt, that's not true, is it? Us specialists were not exempt. I am under siege some days with my prescribing. Of course, I went to Catholic school. I was always on the naughty list because I am a large mouth, I'm very honest, and I swore a lot as a child. You learn to swear on the farm. But I don't like this naughty list at all. I'm a specialist, and my prescribing is out of range. Well, if I were a diabetologist, I would be out of range on insulin too, wouldn't I? Because I'm a specialist. This is what I do. So even with all safety measures in place, I am scrutinized and told, if you don't get your MME down, you'll be decredentialed for Medicare and Medicaid. Wait, let me go through my CV. I'm Mayo Clinic, multi-boarded, I forgot to tell you, I have boards. I was the chief resident of the Mayo Clinic, for heaven's sake. And I'm told I don't know how to prescribe. Or I can't identify opioid use disorder. Wow. I used to be able to service my own F-150, but if anyone has a new Ford, I can't even find the engine anymore. Can you imagine going to the Ford dealer and me tell them, you fixed that thing, when my 5-year-old granddaughter has to show me how to use my damn iPhone? So there's things that changed here, but I'm the expert. I'm the one. And I also appreciate, I think it was Councilwoman Schultz was saying, that to impugn all of us, the gateway drug to addiction is alcohol and the ACE score, which I'm sure you know about too. You've really educated yourself. So we need to look at root cause, not just if an opioid was around. And was it illicit fentanyl, or was it something that I wrote? And when you really look at it, most of them were, as we know, as you honestly said too tonight, the fentanyl is absolutely terrifying. Carfentanil is terrifying. It's being laced in all these things. People may think they're getting a fake oxy pill, and it's fentanyl. Boom. It's unbelievable, stunning. So we definitely need to focus on that. So excellent point you made to educate yourself. I'm going to talk a little bit more also, and I'm like poor Miss Lavelle, I could talk all night. Probably want to set me down already. But these CDC guidelines, oh, Heavenly Father, this is getting old. So, ta-da. Thank God for this tiny little organization called the AMA. When the CDC guidelines came out in 2016, us pain specialists were terrified because we knew a subset of patients needed this. This was life for them. We were very worried. And I wasn't the only one worried. Here's the worry list. I think I don't know if these are projected or not. The American Medical Association, American Society of Clinical Oncology, American Society of Clinical Society, American Scientific Counselors, American Society of Anesthesiologists, that's my group, American Cancer Society, American Society of Hematology, National Comprehensive Cancer Network, American Council on Science and Health. And interestingly enough, also, recently, the CDC is even worried about their own self in their letter they put out. And of course, DHHS just came out with a whole new set of really interesting, good things, which I'm going to be happy to show you tonight if you want to see it, because it has really helped me then feel more comfortable as a specialist even, because as we know, patients are absolutely being abandoned. That's absolutely the truth. Okay, so this is a large group, but even the AMA came out and resolved that our AMA advocate against misapplication of the CDC for prescribing opioids by pharmacists, health insurers, pharmacy benefit managers, legislatures, and governmental and regulatory bodies in a way that limits patients' access to opioid analgesics. Concerning. Also, that resolved that the AMA advocate that no entity shall use MME, morphine, milligram equivalent thresholds as anything more than a guidance, and physicians should not be subject to professional discipline, loss of board certification, loss of clinical privileges, criminal prosecution, civil liability, or other penalties or practice limitations solely for prescribing opioids at a quantity level above the threshold, the MME, the CDC. Can you imagine the chill you would get as your profession if this was handed to you? You've dedicated your whole life to this, and this is what happens. So, I'm proud to say the CDC even came out and backtracked, which I know is rare for governmental agencies. We won't disparage. So here again, inappropriate use for prescribing of opioids. The AMA comes out very clearly again and says, caution, do not punish the doctor or the pain patient. the American Society of Clinical Oncology and American Society of Hematology and the National Comprehensive Cancer Network. Once again, CDC issues key clarifications because of our major concerns. I had a gentleman in the other day, I was doing an injection on his back. I certainly do more than write opioids. And in fact, none of us enjoy writing opioids at all. But I was doing an injection on his back because he had rectal cancer. And he said, Dr. Hess, can I confide something in you, or can I ask you a question? I said, yes. He goes, my father passed away 2 years ago from metastatic prostate cancer. And he was told he could not have a pain med because he might become addicted. How many of these stories do we need to hear, you guys? We hear this, I won't exaggerate, but I would say at least once or twice a week or more. Minnesota can do better. I'm sorry. It's heartbreaking. We treat dogs better. Okay. American Society of Anesthesiologists, which is my group. Okay. I'll make a little joke. We're the biggest drug pushers in town. Of course, it's all legal. Don't worry. It's all legal. Who doesn't love a good propofol when they have their colonoscopy? Okay. ASA makes 4 recommendations to the CDC. Again, folks, one more. Leading organization says this. Okay. The FDA had to come out and also clarify because they were concerned, because harm was being done. I think this has been mentioned already tonight. New England Journal of Medicine, and again, a little throwaway journal, actually one of the most prestigious there is, also came out. There are no shortcuts to safer opioid prescribing. Interestingly enough, these are the same people that were pushing the CDC guidelines. You can see why some of us are a little frosty about it. The opioid work group, this was the national one, which I found to be much less biased, actually came out. Let me go, I'm happy to have these if you wish too. Let me just go to the back. Overreach of the guideline to exempted populations, cancer, sickle cell, OUD, overreach. Inflexible applications, various misinterpretations, unintended side effects, concreteness of provisions. Once again, overreach. And felt that we need to go back to the drawing board. And what made me most concerned, especially Councilwoman Schultz, as I did with you too, is when I read, and you too, Mr. Keeley, was that the language of this settlement was basically no opioids and you will follow the CDC guidelines, even though, as you can tell from the little bit I've already talked, the CDC guidelines are in major contempt right now. They were rushed, there was no scientific evidence, and it did not go through the proper channels in 2016. But of course, we as pain specialists were then thrown in front of the bus saying that we're just doing this to protect our practice. It's always easy to be cynical in this country. It was to protect our patients, for most of us. Well, minus the pill mills on that one. Okay, the H3. This is just a list of the amount of people who have sent. I think there's almost 40 pages of signatures on this. All the big name pain specialists who really, I believe, are focusing solely on good patient care. Almost done. DHHS. I actually read all this. And you guys are such good readers. I don't know, you must have gone to Catholic school too, speed readers, because you've done a good job of your homework, and I'm incredibly proud of you, Burnsville. Okay, once again, this just encapsulates the whole picture again about the CDC. So, am I almost out of time? I'll try.
Yeah.
I'm sorry.
We've got a whole list of
I know you
folks
do.
who
I'm so
want to
sorry.
speak.
So in other words, we could just go back through the whole CDC guidelines, the raising of this. This is, again, the DHHS best practices. And I think I can actually end on that. My concerns, why I would vote against this. Very clearly, number 1, F, part 2, prevention. Funding medical provider education outreach regarding best prescribing practices for opioids consistent with guidelines for prescribing opioids from the U.S. Centers of the CDC, the Disease Control and Prevention. Again, as I've shown you, these CDC guidelines have been amply had questions raised by very credible organizations on behalf of patients. And that's where I'm very impressed at the fact that you Burnsville Council read this. What worried me very much was the same thing when I saw that webinar too. The head of Minnesota, the League of Minnesota Cities said the #1 cause of overdose was doctors prescribing. That disparages me, and it is not true. So truth is needed and light should be shown on this, and thank you for also noticing that. And then #5, I do worry about HIPAA. I worry very much about privacy. And as Councilmember Keeley very much said, the doctor-patient relationship over and over is eroded. And I agree with Councilmember Keeley, it's not been ever good for you or me. So thank you for that very, very thoughtful statement. And then in the end, I'm going to do a little plug. And again, I'm going to ask Representative Baker and others in the room, as Councilwoman Schultz has. We have some very nice legislation out there called 152.125, intractable pain. This is the bill we're talking about. If we really want to make a statement on how we truly feel about dealing with pain patients, can we not start with something as simple as this? Many people have intractable pain. They should not have to be afraid. Physicians should not be afraid to prescribe because they're worried about losing their license, losing their insurance, losing their livelihood. So there's the bill in the House, and there's the bill in the Senate. I would urge every one of you to talk, this is Mr. Berman's bill, to talk, keep the language going. Let us always focus on what is good and how we can help patients. In the end, none of us in this room know in a year where we'll be. We could have stage 4 cancer. You could be in a horrendous car accident. You could have your arm severed like a gentleman I just saw in a terrible accident, who is going to live with Councilmember Keeley's 9 out of 10 pain for the rest of his life. Let us not ever take for granted that that person may be you. There's one thing I repeat to myself too, because I'm religious or spiritual. Every day I drive across the bridge into beautiful downtown St. Paul, I say this: whatsoever I do to the least of my brothers and sisters, that you do unto me. We need to remember why we're here. We need to remember the people we serve. And as you look at this, the language needs to be changed, and unfortunately it can't. Thank you very much for your time. Really appreciate it.
Thank you, Dr. Hess. I think with Representative Baker's help, that language can be changed.
It cannot.
No, it can't, unfortunately, legally.
The legislation can be changed.
Yeah, the legislation
Yeah.
could, I believe.
No.
Legislation.
Legislation is, yeah.
I think the
Through
language
the
is blocked.
Yeah, it's
That's
the
what makes us
legislation.
nervous.
Yeah.
But what we're voting on is the settlement with the
Yeah.
memorandum of agreement, and that cannot be changed.
Yeah.
Unfortunately.
So we'll continue to work through all of this. Okay. Councilmember Gustafson.
I just wanted to say I got some text during all these testimonies here from Representative Berg, Representative Hansen, and Senator Port, and they will engage with this as well. And so we're getting bipartisan in all this right now is what's going on there. So, and I also just wanted to say one thing, and I appreciate everybody coming out here, and we'll listen to you all night if we have to. That's fine. I don't think anybody up here is against anyone getting the treatments they need in their life. That's not what this is all about for us. And I know you have some issues about it, and I get that, but I don't, there's nobody at this council that believes that you should have your pain medicine taken away from you. It shouldn't be cut down if you need it. I mean, we just don't believe that. And it's unfortunate, some of the things that are in that settlement, but I think through our legislators, we can change some of that and move forward. And I'm really hoping that, and I'm encouraged by hearing from some other representatives and senators that they want to be part of this, so. And I know we do also have some residents on Zoom that would love to speak, but they haven't been able to get in. We normally don't have testimony that lasts 45 minutes per person, especially when we got all these people talking, and we'll be here till 2 in the morning, easy. And so, just to let you know.
No, we won't. We'll be here till 10.
Oh, 10, 11.
No.
Yeah, 11 o'clock is mandatory. We have to shut down 11.
10.
10? Oh, was it 10? Okay.
10,
That's right.
mandatory. So, you know, we'll get through it, and we'll also understand who's against it. And, you know, one of the things that I usually say when we have a lot of people who want to testify is that if you have new information, we would love to hear about it. But if you're here to say, don't vote for the settlement, you know, then I will see and we will take account of who's here. But if you have new information, that we would like to see. So we'll continue. Councilmember Keeley.
I just want to point out that this process is happening as it should have the first time we talked about this, but it was just not given the attention that it needed. And I'm grateful for everyone who has spoken. This is the information that we needed to make an informed decision and an educated decision. And although it has been, there's been some lengthy presentations, there's not 1 minute that I haven't been glued to the speaker, whoever they are, and learned a ton from each one of them. Thank you very much for coming out.
Yeah.
And I know we have a limit at 11 o'clock.
No, 10.
Or 10 o'clock, sorry. Edina runs till 2 in the morning, but we cut it off at 10 o'clock. So,
Cake eaters.
okay.
They bring cake in.
Cake eaters.
They just bring cake in all night.
Yeah.
So thank you very much. I'm interested in hearing more people speak.
Yeah, and we do have our next speaker, and she is virtual. Ms. Colleen Ronnie?
Yes, hi.
Yes. Colleen
Can you guys hear
Ronnie.
me? Yes. Can you hear me and see me?
Yes, we can hear you, and welcome.
Thank you very much. I first would like to thank you for an opportunity to talk. My name is Colleen Ronnie. I live at 6666 Mulberry Circle in Chanhassen. I have lived on both sides of the aisle. And I promise everyone, I'm not going to talk for 45 minutes. I'm going to keep it short and sweet as I can. I know there are about 30 others who are waiting to speak. So I lost my son, who was 20 years old, 6 years ago to an overdose. His addiction started with wisdom teeth being removed, and then an infection that developed afterwards, and was given another 4 weeks worth of opioids. I also have a husband who was recently diagnosed with stage 4 bladder cancer and has been treated down at Mayo now the last 4 years. But I can say that he never in his entire time and many months at Mayo was denied adequate pain medication. I also want to express, while I know that this process is difficult, it can be frustrating. I have worked in almost every avenue of this issue since Luke passed away. I have utmost trust in Representative Baker. He is passionate about this. He was one of the very first people to say, Colleen, I understand things do not always go the way we want or as quickly as we want them to. The process isn't perfect, but as we move towards solutions, problems will arise, and that doesn't mean that we can't go back and fix those things as they arise. My position is from an entirely different perspective. I would like very much to address the lack of education for young people that a vote for yes would provide, in addition to everything that the law enforcement folks are doing, in addition to the EMTs, in addition to the court systems and the service providers and the medical providers. We have a tragic lack of education for young people throughout the state of Minnesota. And I have spent the last 5 years traveling all over the state educating middle and high school kids. I have talked to 45,000 students, educators, and parents. And those are those things. I've been plagued with not being able to receive funding to do some very important work. And I am not alone, because there are other areas that need to be addressed that this settlement money would allow for. I think most people would be shocked to realize that the problems that have been discussed, the press pills, the fentanyl, Narcan, some of the issues, young people are not getting this information. 70 to 80% of high school kids believe that they will be arrested if they call 911 for someone who is overdosing. 75% of kids do not know about pressed pills or that pills that they may take at a party or with friends could be full of fentanyl. That 2 out of 5 pills actually right now in the state of Minnesota are lethal if they are not coming from a pharmacy. There are problems with all of these things that we can fix, but walking away from money is nothing more than walking away from an ability to put more money into the process to fix things. I read a quote that as a parent I find absolutely appalling, that people who are stepping up to take this money are doing more than, are just really basically stepping up to the trough. And I would say that as a person who has volunteered her time for the last 6 years on this issue, I will gladly step up to the trough if it means that young people will be educated and will not die because they don't have simple information about Narcan or how to recognize an overdose, or that they can self-advocate when they are being prescribed medications, that they, give them some tools. Give young people tools so that when they do go to the doctor, they can ask questions. We have to teach them that. And if we're not doing that, they're not going to learn that they can self-advocate. They can say, you know what, I really do need this. But can you tell me if these medications are addictive? Do they have addictive qualities? Are there alternatives? Can I utilize acupuncture or chiropractic medicine or other forms of pain relief that are not narcotic? We don't really teach kids that. We don't even hardly teach adults that. I mean, I listened to my doctors, I trusted them. They used the best information that they had at the time that they prescribed Luke. Had I known that his brain chemistry was changing in 3 to 5 days of starting those medications, I would never have allowed him to continue to take those meds. I would have asked for alternatives. I would have sought other means to deal with his pain. And by the time we did figure it out, it was really too late for Luke. He got great care. He got great services. It was not enough for him. And I am not alone. And there are young people in the city of Burnsville who are struggling right now. There are parents in the city of Burnsville who have lost their children and walking away from the settlement money, voting no for the settlement money is doing a tremendous disservice to the people in your city. So I don't know. I mean, I would just implore you. Yes, there are problems. Yes, there will continue to be problems, but we can't solve problems by walking away with monetary means that will help us address them. So I would encourage everybody on the council to reconsider in a fashion that would bring more means to have some of these things be accessible to them. And if anybody has any questions, my son was an amazing kid, just as Dan's son was an amazing young man. We are losing way too many people. And I don't think anyone would dispute that sometimes the language isn't well written, or that doctors have overprescribed, or that doctors feel worried that their prescribing is going to be regulated, or that chronic pain patients are worried. They have a reason to be worried, but walking away from money won't solve any of those things. So I would just ask that you consider the value to the citizens of Burnsville and to the other citizens throughout the state who will be denied more funding if the city steps away from voting yes for this money. If anybody has any questions, let me know.
Yeah. Thank you so much for your testimony and for your words and for addressing the education piece of what these funds can be used for. Thank you.
Thank you.
Yeah.
Thank you for the opportunity.
Okay, we will move on. The next person who is asked to speak is Ashley Corvin. Good evening, and give us your name and address for the record, please.
My name's Ashley Corvin, and my address is 1907 West 5th Street in Red Wing. I'm going to be using the chair as well. I am also a chronic pain advocate. I'm also a chronic pain patient. I have testified in front of the opioid work group about my story, which is one of the places that we've mentioned that we are being credited as giving a voice to chronic pain patients. I want to thank everybody for allowing me to speak today, members of the City Council, state representatives. I'm here not just to share my story, but to talk for all chronic pain patients like me. My story is a little bit different from what you've heard so far. I have also been touched by the loss of addiction. My chronic pain condition is actually something that is genetic. I was born with it. But for me, it did not activate until I lost a loved one due to addiction. This was a person in my life that was there holding my hand while I was giving birth to my first child. She was like a sister to me. So I understand that this is complicated. There's emotions on both sides. But I also know that pushing under the rug, saying we're gonna fix this, don't worry about this language, is a mistake. Bills like the bill that Councilmember Schultz has brought up has been in the works for years, absolute years. So to say we need this money, we need this education for people to understand about addiction, we're gonna fix this later, I think we can do better. I think we absolutely can do better. In my situation, my chronic pain condition basically started overnight with no reason. I was 38 years old. I woke up one day and I couldn't get out of bed. I was a homeschooling mom to 3 young kids, was married at the time, and all of a sudden, basic things like brushing my teeth, being able to reach the back of my head to undress myself, dress myself, were no longer an option. And as most of you know with kids, they don't get that. You don't get a day when all of a sudden you can't be mom anymore, right? Simple things like sitting in this chair, the same chairs that you guys are sitting in right now. Every single day I go somewhere, I have to wonder how long I can sit in that chair without feeling like I have needles going through my legs. And, you know, whether a chair has a back or not, those just simple things healthy people take for granted. And here's the thing, is most chronic pain patients, we're not saying addiction's not a problem. I think where it gets dicey for us is the fact that a lot of this data is getting blurred together. We're getting prescription opioids are the problem at the same slide that we're talking about heroin and illicit fentanyl use. That's the problem, because your average lay person sees that and they're hearing that prescribing opioids is the problem. In my case, just some examples of things that we've been talking a lot about MMEs tonight. For me, for the CDC guidelines, even though I think we've already addressed that they are not awesome, the guideline is 50 MMEs or over is what the problem is. The highest level of MME I've ever been on is 10. And on that dosage, with one point in my career as a chronic pain patient, I needed that every single day. I've had medications denied because the pharmacist didn't like the way I looked. I've had them denied because I filled my prescription 3 days late. I've been denied because I didn't have an ID, or I did have an ID, or after a divorce my name had changed, even though I had been at that pharmacy and provided divorce documents. I've had authorizations by health companies denied, even though I've been on that medication for 5 years. The provider that I was seeing treated 100% pain patients. They were a specialist who treated my condition who had a multifaceted approach. We did diet changes, we did lifestyle changes, stress management. Tramadol was just a tool in the toolbox. You know, for me, I was a lucky one. I'm actually not on opioid medications anymore. And the reason for that is because my doctor was able to prescribe the medications that I needed to break the pain cycle. But I am the exception to that rule. That's the thing I need to understand is there's so many conditions that our conditions are complicated. I have 3 different conditions, all of which there are no cure. And every time I recently moved, I had to fear if I could get my medication just because I was moving from Sherburne County, north of the cities, down to Red Wing. I actually decided to go a different direction. But just moving cities within our own state, chronic pain patients are having to worry about if we're going to be able to get the adequate care. And here's the thing for me is, you know, I also have hypothyroidism, right? My body does not make thyroid hormones. I have to take that pill every single day because my thyroid doesn't work. In essence, my body also creates pain every single day, no matter how much I will it not to, or think harder, or how much I meditate or manage my stress. Would you tell me I can't take my thyroid medication because I'm dependent on it? I need it every single day. It seems a little ridiculous, right? But that's what we're telling pain patients. I've been on Tramadol. That's the only medication I've been on. The MME on that, it shouldn't, I've had many doctors, it shouldn't even be on the list, but it is. And the overarching things about this medication, even kind of shown on the slide presented by Chief Schwartz, you know, there was a Xanax, there was an anxiety medication on there, there was a sleeping medication on there. These broad strokes and overarching languages that people say, hey, we're just gonna fix this tomorrow, they're affecting people who don't even have pain problems as well. You know, the 2 FDA-approved medications for my condition that, quite frankly, actually don't work for most of us are also on those kinds of lists. So I'm an optimist. I want to believe in the good faith and hope, and I want to come out of this meeting with more advocates and allies. But the thing is allies are made by actions. Allies aren't made by saying our names and looking at us in the face. They're by hearing our stories and knowing that we exist, and these things are happening right now. In my situation, based by the CDC guidelines, I should never have had a problem filling my medication. It was such a negligible amount. But I cannot tell you, it didn't matter how many rules I followed, how many phone calls I called beforehand, I have been denied medications over and over and over again, even though I am 1/5 of the CDC guideline. And in my life, that little bit of medication was the difference between being employable and completely permanently disabled and reliant on the state for my income. Because when we're talking about dollars here, we're talking about money, we're talking about the cost of healthcare, that's the other side of it. How many people are becoming permanently unemployable and disabled because their pain is not controllable? You know, I am very blessed. I work for an amazing company. I joke that I've been remote before it was cool. I've been remote with my company the entire time, but quite frankly, it's the only reason why I'm able to be employed. You know, and taking the settlement, you're telling pain patients that we don't see you, that the potential harm and or deaths due to addiction are more important than people who have killed themselves due to pain not being taken care of. I know people who have killed themselves because the pain was too much. I have family members who have considered it for fear of legislations like this that continually getting tied to decisions, and we're continually told, next time we'll get it better. I really applaud the city of Burnsville for bringing this to light and being strong and taking a look at this. I was very sad to hear Councilmember Schultz say the other cities just put it on a yes docket. You know, I applaud you guys for taking a look, and the way you can let us know that you understand it's a complicated issue and not one where one side wins and another side loses is by voting no. And I really appreciate you taking the time to hear me today. and know that we get it. We just want you to hear us and understand that per your attorneys, you cannot change that verbiage. So a yes vote, you're saying, okay, we're gonna crack down more on people like me. So I ask that you guys vote no, and then continue working with the state on other bills and getting those pushed through. But right now, today, we're asking for a no. Thank you.
Thank you. The next person to speak is Amber Bullington. And give us your name and address for the record, please.
Use the chair as well. And it's very high, even for someone who's 5'9". My name is Amber Bullington. I live at 4917 Acorn Ridge Road in Minnetonka. I am an advocate for pain patients. I've done this for years. At the state level, I've attended almost every opioid prescribing work group meeting over the past several years. I have arranged listening sessions for chronic pain patients to be heard by the OPWG. One member showed up. I don't feel heard when one member shows up to a meeting and the rest don't want to hear from us. They're tired of hearing from us. I've spoken till I'm blue in the face to the OPWG, and they just don't care. They just don't listen. You know? Heroin pills. We're all addicts. We're all drug seekers. What I'm hearing up here today is that it's about money. And it's the money that's going to come off of my back. You're going to tax my medication? I pay for addiction treatment. Yes, absolutely needed. Why does it have to come out of my pocket? All I did was be born with a genetic disorder. I've been sick for almost 21 years. I'm tired. I'm tired of going on television. I'm tired of writing letters, of writing articles, of talking to representatives, to going to government meetings and not being heard. So you get $1 million and you turn your back on pain patients for that $1 million. Doesn't feel very good. It just doesn't. So I want to talk about MMEs a little bit. I have, like I said, a genetic disorder, and I have other genetic issues. One of them is I don't process medications like other people. It takes way more medication for me to get the same effect as someone else. So when you say you can't take more than X amount of medicine, you're completely denying people that are not processing those medications like others. And you're not letting the doctor explore that and make those decisions with their knowledge. They've been trained to do this. So MME's bad. And doctors are being prosecuted, and so their fear is absolutely warranted. I just, you keep saying, we're going to get it right. We're going to get it right. My medication was taken away 4.5 years ago. How long do I have to wait? How much of my life do I have to give up? Well, y'all figure it out. I'm a mom. I got 2 kids. My heart breaks for you that you lost your kid. I can't even imagine. But my 2 children also have this genetic disorder. They're 19 and 22. My 22-year-old can barely get to her classes in the morning at college because she's in so much pain, and she can't get any pain medication. Mine were yanked away. I was at very high levels. It almost killed me. I had doctors say, you can't leave here. You're gonna die of a heart attack. I have chronic high blood pressure from untreated pain. Untreated pain is a disease in and of itself. So when you say, I'm gonna take $1 million and I'm gonna do this, I'm gonna help these people, I love that. Let's help people. But why? Why are you going to take it off my back? Why are you going to take it out of my pocket? And why is it always about money? I used to coach 2 sports, fast pitch softball and basketball. I did the yearbook for years for my kids. You know, there's a lot of things that I'd like to do with my life that I can't do because I don't have any pain medication. Not one pill. And I have been to so many pain clinics and so many doctors. I went to over 100 doctors in 19 years to get the actual diagnosis. Over 100 doctors. Do you know how much time I spent in doctor's office? Don't forget about us. We're here. I ask, vote no. Vote no on this. Hear us, see us, care about us. Don't wait till tomorrow to help us. We've been waiting. I'm 55 years old. I've been sick since I was 34 years old. How long do I have to wait? How long till I get my life back? How long do I have to wait? How long do my kids have to wait to have a great mom? All those kids out there that I can't coach anymore. And I'd like to think I made a difference in their lives. I really do. Vote no, just vote no. I really appreciate you taking the time to hear us. It feels good to be listened to. Thank you.
Thank you. I'm sorry that you didn't speak at your city in Minnetonka. You know, yes.
But at least someone's speaking for the citizens of Burnsville that can't be here.
Thank you, Madam Mayor and Council. I just wanted to make a brief comment. There are a lot of citizens from Burnsville who are having a hard time, sticking around long enough to make their testimony. So I know that they would like to be heard. So there's a lot of people who want to be heard tonight. If we could just keep testimony, succinct, brief, and just respectful. If everyone wants to testify, I just want to put that in there. Thank you all.
Thank you. One of the things that we've heard a lot of stories, and I know that Burnsville citizens want to speak, and we've had citizens from different cities, and not one Burnsville citizen. And I know you're all sitting there looking at me saying, what about us? And so I just want to ask all of you who are sitting here, you're here to ask us to vote no on the settlement. Am I correct?
No, that's incorrect.
No, over on this side.
Oh, no.
I'm here to ask you to vote no.
You're asking to vote no? Vote no. I see a hand of all vote no's. Okay. How many of you are from Burnsville? Okay. So 3 of you are from Burnsville, and the rest of you are from other cities. Okay. Thank you for being present today, and thank you for being here at our meeting to show your support for the folks who are saying, don't vote yes for the settlement. And so I thank you. And I know I've been getting text messages from people saying, what about Burnsville? So, and you've been patient. So, let's see, who's on my list? I have Mark Kindy, and he's from MDH. Mr. Kindy. But before you speak, Mr. Kindy, who from Burnsville wants to speak? And give me your name, please.
I'm Pam Lanhart. I'm on the list.
You're
Pamela Lanhart.
Pamela, yes. Okay.
I also run a nonprofit based out of Burnsville.
Yes, Pamela. So, and then I'll have you, Mr. Kindy, come up, but I think I have to have the voice of Burnsville citizens. They have been patient, sitting, and waiting. Welcome.
Thank you. My name again is Pamela Lanhart. I live at 1505 Raleigh Drive in Burnsville. I'm also the founder and executive director of a nonprofit called Thrive Family Recovery Resources that has operated out of Burnsville for the last 7 years. I've partnered with the community for the last 11 years because my son was a young person addicted by opiate use disorder. Sorry. He passed away October 23rd of this year. And yes, he passed away from a fentanyl overdose, but that's not how his addiction started. And the data from the CDC supports the fact that 75 to 80% of people that end up using fentanyl have had their addiction activated by opioids, prescribed opioids. My son broke his femur when he was in high school, and as you guys know, like, that's a very serious accident. He did have to have fentanyl in order to even move, but it did activate his addiction to opiates, which then ultimately escalated to a fentanyl overdose. I've been active nationally as an advocate and an ally for families affected by substance use disorder, including individuals that were intimately involved with the Purdue settlement. And I think we're missing the point here tonight. We're not going to tax you on this. This is an opioid settlement. This was because the pharmaceutical companies were complicit in the overprescription of pharmaceutical opioids. They admitted to deceptive marketing practices. They admitted to kickbacks and incentives to doctors for the overprescribing of opioids, right? So we're not talking about tax dollars going to fund programs. We're talking about money that's going to come to Minnesota. This money is coming. Whether you want to join the settlement or not, it's coming to Minnesota, right? And the question here tonight is whether you join in the settlement, right? Ryan Hampton, who was he was appointed by the Department of Justice as a representative and the co-chair of the committee in the bankruptcy litigation. He was so discouraged by what was going on with this litigation that he wrote the book Unsettled. He's a close personal friend of mine, and we've had conversations about this. And I've talked to him about his thoughts on this, having been intimately involved with the litigation process and with the settlements to our communities. The miscarriage of justice is unconscionable. And while one thing is abundantly clear, that the only winners in this litigation are the lawyers. Right? They're the ones making the money. So you can choose not to join the settlement and you can try to litigate this on your own for your community, but you could spend millions of dollars. Cities have been, cases have been thrown out. They've lost their cases. What's been clear is that when cities try to litigate themselves, they're not gaining anything. So while $1.1 million doesn't seem a lot, and what we want to make clear here too is this is reparations, right? This is the costs that our communities have already experienced in law enforcement and first responders as a result of the opioid epidemic. This isn't money that is just coming magically because we don't deserve reparations. And the saddest part about this is that the victims of their really the evil, are not really getting anything. I mean, the amount that's actually going to go to the person who lost their loved one is very little in the scheme of what's happening. Now, this isn't an effort to take away pain medication. We have to understand that. Like, that's a whole different issue here, really. And there needs to be legislation passed in order to make sure that, and I have benefited from opioids through multiple surgeries. I have a sister who's on opiate pain medications for chronic pain. I understand what people go through when they have chronic pain. And I don't ever want to minimize that, right? It's really critical that we do pay attention to that. But we're talking about what's happening here in Burnsville right now. Last week, I helped 2 young citizens of Burnsville get into treatment because they were addicted to opioids. They weren't using fentanyl. They were using street pills that they got. They were using opioids, and that's what their addiction started at. It wasn't alcohol, it wasn't marijuana, it was opioids. And they're out on our streets. They're affecting our communities right now, right here in the city of Burnsville. I just got a call from a mother whose 15-year-old graduated from opiate pills to fentanyl. 15 years old. So what I'd like to see is, and we talk about the appropriations of this $1.1 million, which really, we're talking about $61,000 a year. It's not a ton of money, right? But I would like to ask for a small task force that would guide how the city is going to appropriate those funds if they do allocate, get allocated from the settlement. And I think it should consist of stakeholders, families that have been affected, by pain management, families that have been affected because of the overprescription of opioids. Law enforcement, first responders. I'd like to see more naloxone on the street. I'd like to see more fentanyl test strips so that people who are perhaps activating addiction and using pills would know what they're actually getting. And then as Colleen Ronnie, one of my good friends, said, we'd like to see more involvement in early education. We're spending money pulling people out of the river, but we're not figuring out why they're getting into it in the first place, right? So, upstream, educating our schools, one pill can kill. I got a call from a mother just the other day whose son was 18 and died from a fentanyl overdose because he thought he was taking an oxycodone. So we can't ignore the problem, and we don't want to throw the baby out with the bathwater, right? This is a problem in our community, but we have to remember that this isn't new money. This isn't, money that we're taking out of the law enforcement budget to, do other things with. This is money that is going to come into the state of Minnesota, and I would ask you to strongly consider voting yes, because, no money is better than something. Thank you.
Thank you very much. Let's see, I'll ask Mr. Kendi. So I know, did all of you sign up to speak?
I did.
From-
I signed up last, I believe.
Okay. Burnsville residents?
Yes.
Okay.
We have some on this.
And then we also have quite a few on the Zoom line who also want to speak. Okay, Mr. Kendi, please come forward, and then I really appreciate that all of you who came from other communities to speak at our opportunity to speak on this issue. I really appreciate that, and a lot of you gave some very good testimony. So thank you so much. Yes, I saw their hands go up, and I will recognize them if did you sign up to speak?
No, I didn't know how.
Okay, there was a sign up in the back, but, yeah. So if you sign up, that's the list that I'm going through right now, okay, because we don't want to miss anybody. Okay. Welcome, Mr. Kendi.
Madam Mayor, council members, I'll be very brief. Mark Kendi, I work with the Minnesota Department of Health. I live at 3307 32nd Avenue Northeast, St. Anthony, Minnesota, 55418. Representative Baker teased me as we walked in. Usually I bike back and forth to St. Paul for work. And he said, "Mark, did you bike here?" And I gave out. I did not bike here tonight.
Okay.
Madam Mayor and council members, thank you so much for this opportunity to reconsider and to examine, and thank you for the keen questions. I won't repeat all that's been said. Thank you so much. Drug abuse is treatable, and overdose deaths are preventable. Some of the settlement dollars can certainly be used to extend prevention, intervention, and treatment. I'm not a lawyer, I'm an epidemiologist, so I did not help craft the settlement language that came to all of the states. My colleagues here who are lawyers would say that language can always be improved. My work with Representative Baker and members of the House and Senate, we're in the executive branch, so we work in partnership with the legislative branch, has been over these past years one of striving to do better for all the people of Minnesota. That's our commitment. My commissioner, as Mrs. Lavelle testified, I'd been meeting with Cammie for several years before. My commissioner, Jan Malcolm, approached her after one of the Senate hearings, and Commissioner Malcolm called me up and said, "Mark, please have you and your team meet with Mrs. Lavelle again to see what we can do to make sure we're advancing and we're making sure that people aren't falling through the treatment and the care cracks. And that's exactly what I've seen Representative Baker and his colleagues do as well. Passionately committed to excellent care and to closing some of those treatment gaps. My thought on the settlement dollars was that saying yes, voting yes, lets you do just that. It helps extend best care for the people of Minnesota, in your case for the people of Burnsville, and then to a greater extent Dakota County. I would just say in closing that the document that's referenced, document F, or part F of the settlement document, Exhibit A, the key phrase, I think, is that it leads with these ideas may include, but are not limited to the following. And so some of the help that CDC needs in reframing their recommendations and guidelines, absolutely. Some of the work that our state needs to do from my sister agency, the Department of Human Services, absolutely. And we need all voices at table. And that's what Representative Baker has said for the Opioid Epidemic Response Advisory Council. Absolutely open to making sure we're hearing all voices and that we have the strongest service that we can for the people of Minnesota. And my care as my patient is the state of Minnesota. Burnsville's part of that. And so from where I sit as an epidemiologist in the Department of Health, I think that voting yes helps strengthen the city of Burnsville. Happy to answer any questions, and I'm thankful for the chance to come and visit with you this evening.
Well, thank you, Dr. Kendi, for coming in, and thank you for your voice. And it's helpful and optimistic to hear that you are working with Representative Baker and others. We could always do it better.
Thank you, ma'am.
And what we have done is to highlight where the issues are and how we can make it better.
Absolutely.
Okay.
Thank you.
Thank you. Thank you so much. You've been sitting very patiently. And give me your name again. Yes. Because I'm going to.
Kathleen Farber.
Yes. Okay. Yes. Yes. Please come forward. Ms. Farber, you have been, yes, and I see you put down that you're from Burnsville.
Yes, I am from Burnsville.
Yeah. So I'm trying to,
Kathleen Farber, Burnsville, 10920 Territorial Drive, 55337. And quickly about my background, I worked at the Hennepin County Chemical Dependency Center for a little less than a year as an admitting clerk in detox and a secretary in outpatient. I have seen everything. All of my coworkers there were recovering from something, okay, except me. I apparently was the only one. I took care of my mother for 3 years, and during that time, I gave her her morphine twice a day. I was the one that had to go to the drugstore and have the druggist look at me and examine the script and, no, we don't have that here. No, you have to go here. I was the one seeing her doctor, sweating it out when I was trying to get it. I also took care of my sister who was dying of cancer in my house right there on Territorial Drive in Burnsville. I was the one who put the fentanyl patch on her. I was the one who gave her the breakthrough meds when that didn't work. Okay, so I get it. What I don't get is when you're talking about this memorandum of understanding, it sounds to me like there's a whole bunch of inaccurate statements in there, but what is the point? It's not asking you to lay down on the railroad tracks to stop the drugs from going out. It's just, this is just all preamble. And basically, this is just money, and we can do something good with it. And as somebody who lives in Burnsville, I say, why, if you're not tied to some kind of, horrible thing, which to me it doesn't sound like it, you just don't like it. Okay, I get it, you don't like it. My union boss said to me one time, and I hated this at the time, but I have remembered it for the rest of my life. Do not let the perfect be the enemy of the good. This is money that we could use to pay first responders for overtime. Just because it talks about if you have an educational program to say all these nefarious things you don't agree with, okay, don't have that educational program. Do something else. You know, have a better drug collection thing that you already have going on. Have people go out there picking up syringes. There's all kinds of stuff you can do with this money. Don't turn your nose up at money. We need this, and we can do good things with it. And I do trust all of you that if you accept this money, you will do good things with it. You know, this idea of turning your nose up at money because you don't like something that's in there, if it's not tying you to anything, just deal with it.
Thank you, Mrs. Farber. Okay, Mr. Cantrell, Hunter Cantrell.
Oh, Mayor, I will defer to other Burnsville residents before I go up. I'm speaking on behalf of the Dakota Shelter Family Clinic, but I'll let the other residents of Burnsville who have waited speak first.
Okay, let's see. I have, I'm going to switch over to the folks on Zoom. Yes, your name, let me see. Did you sign to?
Yes, Carolyn Thornton.
Yes, Carolyn, please come forward, and then I'll start going to some of the people who are just, because they're not here and they didn't sign in.
Okay, Mayor, Council members, and Mr. Workman, thank you for replying to my email so quickly. If I had known that this was going to be a chronic pain versus possibly illegal substance thing, I would have come better prepared for that subject. But I came as a 25-and-a-half-year resident of Burnsville, a taxpayer, and I've seen some things happen in this neighborhood. This is a neighborhood that I love living in, but I've seen some things changing. I don't know how people got addicted.
Did you give your address for the
record? Oh, no, I didn't.
Please do.
I thought you
did. Mrs. Thornton.
Okay, Carolyn Thornton, 13236 Fremont Avenue South, Burnsville, Minnesota, 55337-2404.
Thank you, thank you. That's it. And the other thing is that we'll understand the neighborhood that you're talking about.
Exactly. Okay, my husband used to be a letter carrier in Burnsville.
Yeah.
The only African-American one for a long, long time, so.
Yeah.
All right. So I've seen opioid and chemical dependencies become one of the most urgent problems in our cities. I don't know how people get addicted, whether it's from smoking pot, cough syrup. I was volunteering at Nicola one day, and we had to spray the whipped cream, because people get high off of that. So I don't know, and I don't care how they get addicted, but I think we have a problem and we need to address it, and we need to, if we've got money to do anything that can help with that, I think we need to do it. I understand chronic pain. I lost my husband last year, almost a year, almost to the day. I lost my mother 5 months before that. I too had to administer her morphine. I understand. But also when I was with my mother, I had relatives saying, "You got any morphine left? Can you give me some?" So I know that although hers was prescribed legally for her, there are people that it can get into the wrong hands of. I was the one that had to take it to the police station and dispose of what was left after she passed away. So what I'm saying is, for me and for this community that I love, if there's any money, because I'm a taxpayer, and opioid addiction is getting worse all over the country. It's gonna get worse in Burnsville, so we need to do something about it, because whose taxes is gonna go up? Mine, yours, anybody else that lives in Burnsville that owns property. And as a retiree, my salary's not really going up. So I'm saying that whatever we can do, let's please accept this money and make it go for good. I understand that you all are overworked. I could just see when you knock on the door, and you don't know what you're knocking on that door for. But if it's somebody with an addiction or a substance abuse problem, I've got young grandchildren. My sons are getting older now. But whenever they go out and they say they go to a party, grandma has to tell them, don't drink this, sit your drink down, don't drink that, don't smoke that, don't swallow this, because they need this education. And now with COVID, people are not even getting the little education they were getting because we're not even communicating with each other. You know, I didn't know this was happening until I saw this article in the paper. I couldn't understand why we were turning down money that could possibly do some good. I understand pain. Trust me, I do. I have pain. Fortunately, not as bad as some others, but one day it could be. So I think we should be able to separate the two. And I do think that might be an issue, but it's not a Burnsville City Council issue. Right now, our issue should be the things that are affecting our city, the people in our city, and whether they're addicted to opioid at the age of 15 or 65. We need to do what we can. So I'm asking you to vote to accept this money and let's make it do good.
Okay, thank you. Thank you, Ms. Thornton. Let's see. Yes. Did you sign up in the green? Yes. Your name is? Pardon me? Beatrice. Yes. Please come forward. Yeah. And give us your name and address for the record.
Beatrice Winters, 408 Crystal Lake Road, East Burnsville.
Yes. Welcome.
Thank you. I had a long dissertation. But for the sake of time, I'm going to go straight to the point. I heard the testimonies of experts, and it makes me feel as though it's on the shoulders of Burnsville residents to right the wrongs of the federal government and the state of Minnesota. It feels that way. When I have a question for the council members that are voting to forfeit this $1.1 million. As a Burnsville citizen, I would like you to explain to the rest of the city residents how does forfeiting that money benefits our lives.
Okay. Councilmember Schultz.
I will be happy to answer your question, and will be doing so in detail. However, I have been holding my comments so that everyone else in our Burnsville residents could comment first, because it will be lengthy. So I will answer your question. I will answer your question in detail. I firmly believe that residents should not only know how we vote, but they should know why we voted that way and what was the thought process for how we got there. Because at that point, you can agree with us or disagree with us, but you need to know our thought process and how we got there and why we did that so that you can make an evaluation as a resident. So I absolutely will be answering your question.
I'm looking forward to hearing it because, again, as a Burnsville citizen, I want to know how directly impacts our lives for the better.
Okay.
And I will be answering that.
Thank you.
Okay. Thank you so much for coming forward. Okay. Let's see, who else from Burnsville? Yes. Did you sign up?
No, I didn't know about to sign up.
Okay, let me see the people who have already signed up. Okay. Rebecca Barnack, are you from Burnsville?
She's left.
Oh, she left? I'm sorry. Chris John, are you from Burnsville?
Yeah.
Yeah. That's right. I do know you.
Just a little bit.
Yes.
Just kind of,
Yeah,
sort of
yeah.
Burnsville.
It's the mask,
Yeah,
hid
it's,
behind the mask
yeah,
there.
Chris, it's the mask. Yeah, so,
Thank
and
you.
welcome.
My name is Chris John. I'm 12915 18th Avenue South in Burnsville. And I got to tell you, I'm with Councilmember Keeley that's sitting here listening to all these people share their stories have been really eye-opening. I didn't realize what a problem it, you hear about these things in the news and things of that nature, but to hear the firsthand stories like we did really does help to bring it out. So, Councilmember Schultz, I really commend you for putting out that no vote and telling your story and getting us all to hear all these stories and really learn more about the problem that's going on. That being said, I still believe, and I agree with some of the commenters, Representative Baker, he took all my wind out of my sails, what I wanted to say. I think that when it comes down to the 1.1 million, it's only going to do good for us. I understand the issues that are in the litigation. However, there's 105 entities vying for this money for the state of Minnesota. My understanding that 104 of them may have already voted to accept it. Yeah. Us not accepting it is not going to make the strong point that we want to make on just that one piece of the legislation, not the legislation, but the
settlement.
The settlement, yeah. So I completely think that having this extra session may have brought more vision to the problem. But with that, I'm going to close out because there's many people that would like to speak. So thank you for giving me my time.
Well, thank you for coming and telling us your thoughts and what we should do.
Yep.
Because that's what tonight is about. It's about listening to all of you. Okay, thank you. Hunter Cantrell.
No, I believe Robert Timmerman, so.
Okay. So, did you sign up? Oh, Robert, you signed up online. So please come forward because I have an online sheet of paper that was just handed to me, Mr. Timmerman, and then I have the people who signed up. So I was trying to, yes, and Mr. Cantrell had signed up outside. So.
I'll defer to all the Burnsville people on Zoom as well before I speak. Just wanted to tell you that.
Okay, very good. Then I'll go to the Zoom list afterwards, after I address you. Okay. Mr. Timmerman,
Thank
and
you, Madam
welcome.
Mayor.
Yeah.
Yes, I'm Robert Timmerman, 1000 Park Place, Burnsville. I had time to bring my son to piano and back and watch on Zoom and.
And then you decided that you're coming in.
Yeah,
Went to Florida, came back.
I was in Florida until Tuesday
I know
last
you
week.
were.
Oh, it was beautiful. This is a really, really hard decision, and I really appreciate each and every one of you for giving this more than other cities have. I think you lacked some information on the front end and have done a great job of doing some additional fact-finding. So, Councilmember Keeley, thank you very much for bringing this back up to the attention to the rest of the council and to the citizens of Burnsville. I think that's great that you're willing to hear about this from everyone who's joined us tonight. I don't have anything new to say other than one thing, and that is for a short period of time in my career, I was an auditor for the Office of the Legislative Auditor. And one of the tasks that I had was to audit the managed care organizations in Minnesota who are responsible for spending the millions and millions and close to billions of dollars in medical assistance and Medicaid funds. And the few audits that I was involved with were of the prescription benefits managers that the managed care organizations contracted with. And one of the audits that I was most proud of was one that identified some really abusive practices from Big Pharma. And this settlement is an exact replica of some of those abuses that I saw. The items that we had looked at were about spread pricing. It's some secretive pricing that pharmaceutical companies use to hide the true cost of prescription drugs. And that's a large problem when you're trying to manage medical assistance and Medicaid and Medicare for public funds. And that's what I want to bring this back to, is that there are some wonderful, wonderful folks in this room who have shared with you tonight. And I have, like Councilmember Keeley and like Mr. John, who just testified, it's eye-opening. I've learned a lot tonight, and I appreciate that. But what I want to leave you with is that this settlement is about pharmaceutical company greed. And it's not about $1 million coming to Burnsville, and it's not about tens or hundreds of millions of dollars coming to Minnesota. What it's about is big pharma greed and holding them accountable. And based on my experience auditing some of these companies, I thought it was important as a Burnsville resident to reiterate that and remind everyone here that there were some people, individuals, who work at these companies who knew what was happening. And they decided to not pay attention. They decided to put money before lives. And I think that's unacceptable. So tonight, I would ask that you vote yes, no matter how you vote. I just really am proud of each and every one of you for bringing this back up to listen. Thank you very much.
Thank you, Mr. Timmerman. Okay. Please come forward and give us your name and address for the record.
Good evening, Madam Mayor, council members. I'm Heather Jelinek. I live at 2402 Terrace Drive here in Burnsville. I do appreciate everything that everybody has said. As it's been said, this is not a simple issue. It's not simply taking the money or not. Are we denying paying patients their drugs or not? It's not that simple. What we have to look at more than anything is what are the positives of agreeing, what are the negatives? And if those negatives outweigh the positives, which I feel like they do because of the language, yes, we may get $1 million, but how much will we lose caring for our members that are being restricted? And that is my concern with the language in this. The more we restrict these medicines, the more we end up paying caring for our citizens. I've unfortunately seen it, like many others. For me, it's my brother, a proud service member who came home from Iraq with cancer, subsequently breaking his arm and his back because it was bone cancer. He lives with a rod in his arm and part of his lower leg bone missing, in constant pain. Could he be classified as addicted to opioids? Probably, because he can't even take anything over the counter for his pain anymore, because it doesn't work. That being said, he would never want that money over his quality of life. So I implore you, before voting, really take the time to please double check. Because that $1 million, yeah, it sounds great, but let's be honest. In a city our size, it's not going to go far. It is not enough. And yes, this may be a settlement, not tax, but it's blood money. And we want to be the ones to start the saying, no, we're not going to take your blood money, and we're going to fix the problem. So let's focus more on solutions and what just a drop in the hat will do. I'd rather see us be the ripple that fixes the problem versus saying, well, we'll see what good we can do with this money. No, we need to be the ripple. So I urge you, please, vote no.
Okay, thank you. And now, I'll go on to Zoom. Mike O'Brien. Pardon me? Okay, is Jean Foreman on cue? Is she ready? Okay.
Yes, I'm ready.
Okay, Ms. Foreman, welcome. Okay, you want to turn on your, there you are, okay.
Hello. It's dark in here now. All right, thank you so much.
And give us your address for the record, Ms. Foreman.
Oh, yes, thank you, of course. I put it in the chat, but I'm happy to repeat it. My name is Jean Foreman. I live at 3400 West Park Drive in Burnsville, Minnesota.
Welcome.
Thank you so much. And thank you finally for an opportunity to speak after we heard from people from Farmington, Wilmer, Sunfish Lake, Chanhassen, Red Wing, and Minnetonka, St. Anthony, all people who won't be voting for the city council. They got to be here and speak at the city council meeting, and I am been here since 5:30 now finally to speak, and I just want to make that clear that that's been a frustration while I've been sitting here listening to people who don't impact the city council get to speak to the city council. So anyway, moving forward, I did write an email to the city council, and in that I stated that I am a registered nurse. I just retired, but I have 20 years of experience in the ICU during that time, and I worked at Abbott Northwestern Hospital in Minneapolis. I did describe in that email that I have treated people with addiction, with polysubstance abuse disorder in the forms of not being able to be treated properly unless they were in the ICU after when they've been hospitalized because of pain pill addiction, prescription addiction, of tolerance, so much so that it was not safe for them to be in a regular hospital room to be treated for their pain, for fear that the needs that they had to feel some relief from their pain would render them unable to breathe. I've also had people come in who have been addicted and have injured my colleagues, thrashing about as we tried to subdue someone from a near overdose. So those things are real and exist, and I'm, although now retired, I can't tell you how many times that was the main focus of our shift. So these things around addiction are devastating, and they cause a lot of strain and stress on patients, family, and hospital and healthcare workers. I'm here because of the article I read initially in the Burnsville this week, a few weeks ago, with some comments rationalizing why the council voted no. And there are 4 points I'd like to just bring up and address as my response to reading those in the paper from the city council. Number one, blood money. Such a confusing statement. I actually had to look it up and refresh what it means. And in my opinion, this settlement does not fit that definition. It might be more accurate for that label to be applied to the money spent by pharmaceutical companies on lobbyists, on campaign contributions, on creating positions of influence on business boards and other high-ranking positions to guarantee a look the other way, or worse, promote and advocate their interests and ignore lives forever changed or lives lost in the pursuit of profit, which has already been brought up by other speakers. In my opinion, that is the blood money. In any regard, it offended me to have that label applied to this settlement, as it will not ignore or silence people affected by addiction, but rather help them and the communities they live in. I don't think this has to be an either-or type of discussion. I think it can be a both-and type of discussion. The second point is that disturbed me from the council comments was $1 million is not enough to bother with in our large city that has a $100 million budget. Well, I guess I'd like to know, what is our current allocation in the budget? And it sounds like what we heard from our police chief, that we had to cut the resources that we spend on drug task force personnel. So I think this 1.1 million, even though it's spread out over multiple years, I believe it's going to be front-loaded, but it could enhance those efforts. It could start new programs. We could be innovative. We could show Burnsville as a leader in changing the trajectory of addiction, both in the health and well-being of individuals suffering from addiction and in promoting the safety of others that are victimized by drug-related crime. The third point that disturbed me in the article was that the true issue is synthetic fentanyl. In my opinion, this is a what about type of statement that diverts us from thinking of the source of most addiction, which is the legal and approved prescriptions that don't include adjunct therapies, treatment of pain. As a nurse, my experience has been treatment of pain must include the whole person and be an interactive and ongoing treatment, not just a chemical strategy. Anyone who takes opioids long enough does become tolerant. That is the pharmacokinetics of opioid medications. They will become tolerant and medication on those meds. They will not be effective after a time, and the need for more breakthrough and other things does happen. I'm not here to be an expert on pain management, except for what I know in my work as a nurse in an ICU. It is not one thing that fixes pain, but it is multiple things and, again, multiple strategies. This flawed strategy of more and more opioids, because they won't be addictive, is flawed. And it was always promoted, as was stated, by the pharmaceutical companies, and now is not best practice. This focus shifts attention onto some nebulous, untraceable source as the root of our problems here, and away from the real problem: pharmaceutical companies and their greed and need for profit. The final point that was disturbing from the article was this: gorging at the trough, or some comment about being at the trough slopping or something like that. Again, a false conclusion. Taxpayer money was spent at the level of the Attorney General's office for salaries for lawyers, and I'm sure research and other folks to pursue this case and get justice for those affected by the opioid crisis. The folks that are addicted, the folks that aren't here tonight because they've lost their lives to overdose. These funds wouldn't be available to us had not state resources already been spent to join in the multi-state lawsuit to secure these funds for us. It's a restitution in sorts, and we owe it to our residents to accept these funds to make our community better. In conclusion, I ask you all most sincerely to vote yes to accept these funds and put them to good use in Burnsville for treating addiction, education, outreach, rehab or job training programs, and to reduce drug-related crime. The safety of our community, of our healthcare workers, our business partners would benefit greatly from the good that this settlement money could provide. It's not perfect. I'm going to agree with that statement, but it certainly is something that outweighs lingering doubts. No solution will get us 100% there, but the trust that our community has put in all of you, the city council, to do the right thing, to be good stewards of the budget with the goal of Burnsville being a vibrant, livable city, would be well served this evening with a yes vote. And I thank you for your time.
Thank you, Ms. Foreman, for taking the time and for waiting patiently to speak to us, because for us it is about listening to all of you and sharing your thoughts. And you've done a lot of thinking around this subject, and thank you so much.
You're welcome. Thank you again.
Okay. The next is Daniel Clute. Daniel is on Zoom, and so is Mr. Clute on? Okay, it's not Mr.
Yep, hey, I'm here.
Yeah. Hello, Mr. Clute, can you also give us your, we have your name and your address for the record, please?
Yeah, my address is 12412 Villaburn Drive.
Okay, thank you.
I don't want to take up too much time now that we're getting towards the later hours of this, and I don't want to go over, I want to just second a lot of the things that Jean brought up. Firstly, my name is Daniel Clute. I'm a nurse for the mHealth Fairview system. I work in St. Paul. I've been a Burnsville resident since 2019. And I have a long background in in this kind of stuff. Having worked at a hospital that I worked on a wound care floor that was somewhat of like a burn unit and almost a pain clinic, essentially, that treated patients that had complex pain problems. And I also have a family member, my brother, who passed away last year on October 8th, 2021, of a heroin overdose, likely a fentanyl overdose as well. And so this is something that's really close to my heart, and I'm being allowed a very short break from work to have a second to talk about this. And I share some of the concerns that Jean had brought forth, that we haven't had the opportunity to hear from as many members of the Burnsville community. I worry that some of this process has been kind of railroaded by talking about other things that are separate from the settlement and the settlement money and what we can do with that settlement money. I absolutely respect what I've heard from people suffering from, complex pain syndromes, stuff like that. And so I really want to make sure that when the council members are thinking about that, they're thinking about what they've heard from their residents in Burnsville, and what their voices are saying. So, and I hear that the council members are concerned a lot with language within a memorandum, language within the CDC guidelines, while at the same time using, irresponsible language to describe what this is. When they say that it's blood money, when they say that we're lining up at a trough like pigs, when they say that there's a regulatory noose around the opioid industries. One thing that I've learned from chronic pain sufferers is not that they want just greater access and availability to opioid medications. They want relief. They really want relief from pain. And as a nurse, I know that, and what we're all learning as we go along and to change best practices and stuff, is that opioid treatment is not the sole way to get there, that you need adjunct medications. This isn't about throwing shade at the pharmaceutical industry that they're all evil, right? We rely on them to do research, to find new medications, to do drug trials, to get better at this, because frankly, opioid treatments are far from perfect, right? You get a tolerance to the medication, it really changes your body. And what I found, and again, I'm also not a pain specialist, and I'm not here to speak as a specialist that topic. But what's common in people who suffer from a lot of chronic pain syndromes is that at one point they were prescribed a really high dose of opiate narcotics. And so that changes your body. It becomes really difficult to get the chance to try a lot of these adjunct therapies and stuff when you're so far down the line there. So it is really important that we analyze kind of like the language in this, and that we dispel of misinformation and stuff like that. But not letting that kind of stop us from this opportunity that we have. And I think that I like the proposal of a task force to decide how this money should be spent. I think that the community should have a voice in where it's going. So that's one thing. I just want to get to my last part of my comments, because I don't want to repeat kind of things that have already been said. But I just, and maybe at some point, if you guys could clarify the city council that what will happen to this money if it's refused. As far as I can tell, it will just sit and die and disappear, or I don't know. So like Jean said, this was money that was paid for by our tax dollars and pursued by the Attorney General, and it's already a done deal. So, and I really don't want, and I'm hearing things as, from Councilwoman Schultz about being an advocate for people with complex pain syndromes, and I really appreciate that, really from the bottom of my heart. I'm also an advocate, a patient advocate, and I see, people suffering from pain in the hospital that goes untreated, and I advocate for them. And a lot of times it's people who have a history of addiction and a history of overdose. When those people go in the hospital for pain, they often get treated differently because they look in their chart and they see, well, you had a drug overdose, so we're really kind of nervous about giving you any of that stuff, even though obviously you're in pain. We're gonna take a different, approach with you, right? And so, opioid medications are not the only narcotics that are being scrutinized. A lot of people are suffering from ADHD and they can't get stimulant medications because regulations have tightened down so much, and doctors have to be diligent, and a new process is formed and stuff like that. So, and let me tell you, there's a lot of advocacy to be done, and I don't know if folks realize what's happening in the hospitals right now. That the emergency rooms are completely full. We don't have ICU beds in the state. There's so much going on. There's so much advocacy to be done. So honestly, from the bottom of my heart, I thank them for coming to speak today and for advocating those folks. But I am also, someone had brought up and asking, how will it benefit us to reject this money? To me, my perception is that it's kind of like social media grandstanding to make it about one issue, and that needs a voice and that needs to have attention brought to it. But really, I think we really need to look at the benefit that this could give the community, and I would ask that the folks vote yes on this. And sorry, I don't have more prepared remarks, but thanks for your time.
Thank you so much, Mr. Clute. Thank you for taking the time. Okay, the next person on the list is Mr. Michael Bryan.
Hello there.
Hello,
Michael
and
Bryan.
welcome, and give us your address. We have your name.
12721 Greenwood Drive in Burnsville. Apartment 107, if you want to send me mail or something. This is a really difficult situation for me because one of the things I try doing the most is thinking about everyone who's disabled and what's going to benefit the most amount of people in that disability bracket. I feel like I'm sort of in a unique situation here because I was born with half a heart, one lung, and I've probably had more complex surgeries than I've had birthdays. I try my best to make sure everyone's treated fairly, but my whole goal mainly is people who are disabled like myself, because I always feel like we get the short end of the stick no matter what. There's a lot of concern, and this isn't an easy vote. There's a lot to worry about with this settlement, a lot that can hopefully help. What I personally worry about is if $1 million is enough for the damage that's done. What is there to gain by saying no, as the person before said? Is it just like virtue signaling? If so, that doesn't seem good to me. Or would it be productive? Could we actually do something? Like, is there a plan if we voted no that we would do something to change, like to get something out of it? If we're voting no just because we don't feel like we're worried about chronic pain patients, but it's not going to change the results of what happens to people with chronic pain like myself. What good is it? There's a lot to think about. I'm on, personally, I always feel like people who are disabled are treated like secondary citizens. I mean, in this situation, it almost feels like people with chronic pain, you're almost dismissing people with addiction issues, and the people who only think about the addiction issues, sometimes you're dismissing people with chronic pain, and it becomes really difficult to think of, the other person. If I lost my family member from addiction, I'd probably only be able to focus on that. And if I'm like myself, I'm always in chronic pain, and I'm on tramadol right now, it's hard for me to think about worrying about other people with their thing because I'm scared to be in pain. It's like being able to walk, and without pain medication, I can't walk anymore. I feel miserable, and like other people have said, they've thought about suicide, or they know people kill themselves because the pain is too much. But these drugs are also have a lot of bad side effects to them too. So it's not easy. The whole idea with using the money for drug education, I don't know if anybody had experienced DARE, the programs back in schools. Those didn't do anything. Those were terrible. Everyone I knew just thought they were a joke, and that happened all throughout school. When I grew up, we had police come to the schools and teach us all about marijuana, drugs, everything like that. Didn't stop people from still taking drugs. You can only do so much with drug education, especially if you're a kid and you hear it from an adult. It's not going to change your mind. There's too much going on with public pressure and things like that. So I hope money isn't wasted on something like that, because it just doesn't seem helpful to me. I've seen tons of money be wasted in these education programs. And, I mean, it all depends on who you're trying to educate and what you're trying to educate them with. And I'm also curious, this money used for the behavior unit that we have in Burnsville, we always do feel like that department does really good things when it helps people with mental health issues. And some of those people could be people who are on pain meds themselves, because it does have a chance of increasing depression and suicidal thoughts. And that, of course, I still wouldn't want, since I'm on palliative care, I still wouldn't want to be able to have access. I still would want to be able to have access to pain meds. And I've tried my entire life to avoid pain medication. I remember one time I had a surgery and they gave me Percocet. And I just didn't take it because I was scared of being addicted to it. Because my family's had alcohol addiction issues, and I was like, well, if I take this, I'm probably going to have some kind of addiction to it, and I'll end up dying that way. So I just suffered through the pain. That's the kind of like drug education that sometimes scares you into not doing something that could make your life a little bit easier. And I just ended up suffering for a long time for no real reason. In this situation, I feel like disabled people are going to be harmed no matter what. And that really sucks. Because I wish this was like an easy vote. I wish you could just say, yeah, of course, yes. Vote yes. Get the money. Do everything like that, you know. And invest it into helping people hurt the companies that may have done harm to people and caused the abundance of drug addiction and overdoses. And then, you know, I'm afraid of the Section 7 stuff and everything like Schultz and I think others have said that that's worrisome, that, you know, maybe the state doesn't pass legislation to end up fixing this issue if we do vote yes. But again, if we vote no, what does it change? If 87 other cities voted yes and we're going to vote no, are we just doing it just to be different? I don't know. That doesn't seem good either. I just hope we have a plan. We say no. And one last thing. I want to say we vote yes, and we're hoping that the state legislation will pass a bill that makes sure there's no restrictions to people in chronic pain like myself and the others that spoke here today. I think I'm hopeful because I have friends who are representatives, Representative Jess Hansen, Representative Kayla Berg. They're some of the nicest people I know. Jess Hansen, she she really listens if you talk to her. And I've talked to her a ton about disability issues and everything like that. And in 2021, the state passed one of the best health and human services bills I've probably ever seen in my life. Minnesota has one of the best HCBS programs in the entire country. I think it actually is the best. I mean, we're beating out Washington, California, everything else. So when it comes to how we treat disabled people in Minnesota, I want to do better. But if we're looking at our history, we are the best, in my opinion. I've lived in other states. I know a lot of people in other states that are disabled. And I think we do the best. And I believe that we could make sure disabled people are protected if we do say yes. I have that faith. Now, I'm not going to tell you how to vote. That's just my opinion, that I do have faith, and I just want to say my little piece, I guess. But the opioids that I do take have made my life a lot better, and I still do worry about getting stuck on them. And I know other people do too. I don't want to be on this drug. Like, I don't feel great on it. I don't feel like myself sometimes, but without it, I don't want to live sometimes. That's difficult too. That's about it. I just want to thank you all for having this discussion, because this is a really big topic, and it's really good that everyone took the time out and did all this. I really appreciate it. No matter how you guys vote, I just want to say thank you.
Thank you, Mr. O'Brien, and thank you for always being there. Even when you're not feeling good, you also show up to the task force meetings. So thank you for your dedication to our community, and I really appreciate everything that you do. So thank you. Okay, our last speaker is Mr. Hunter Cantrell. Mr. Cantrell. Oh, well, you didn't, I don't have an updated list.
It just happened, Madam Mayor, I'm sorry.
Okay, so who is on cue? We'll come back to you, because you want it to be last, so we'll. Mr. Winters, Andre Winters. Okay, and then Mr. Winters, give us your address for the record. I know that on the chat you said you gave your address, but I need it on the record. Yeah. Okay.
Waiting for him.
Are we waiting for him to come on?
Yes.
Okay. Hello, Mr. Winters. Good evening.
Evening, Mayor. Is my sound okay?
Yep, we can hear you, sir.
Good, thank you. Thank you for allowing me in. I appreciate it. My name is Andre Winters. I'm a Burnsville resident. I live at 408 Crystal Lake Road East in Burnsville. What I'd like to do, and then again, good evening to the council, as well as all the other members in attendance. What I'd like to do, I actually have a question, because I'm a little unclear on why there wouldn't be, some members would not want to accept the funding or the allocation as it states in the MOA. And correct me if I'm wrong, this might be a question for one of the attorneys, but the city of Burnsville is not is part of the litigation. If I'm correct, if I read this correct, it's the state, and then the state is allocating the funding across the counties, like Dakota County, and then if the council votes yes, then you would be allocated the funds. Am I understanding that right, or am I missing?
Mr. Shepherd.
Mayor and council, if you want me to answer
Yes,
that question, I
please.
will. So the settlement is because of multiple state subdivisions sued the manufacturers and distributors. And the states and states AG's office across the country were the conduit for the negotiations, with the idea being if the states could get all the subdivision on board, there could be a massive settlement. But I think it's important to know, because it has come up sometimes tonight about these lawsuits. There's multiple lawsuits. It's not just one lawsuit and language in one lawsuit. Every state, every city and county that participated in the opioid lawsuits filed their own lawsuit with their own language, and then that have come together kind of through this unique way with the states amassing, negotiating the settlement, and then getting everyone litigating and non-litigating entities on board.
Okay.
Well, it's a scale thing too, as
Yes.
well. But the city of Burnsville itself, like for example, isn't listed in MOA as the litigation party, right? Meaning, voting yes or no isn't part of the litigation. The yes or no vote is whether you'll receive the funding from the MOA. Is that correct?
Mr. Shepherd?
Yes, by the city is a non-litigating entity, but by signing on to the settlement agreement, you would be waiving rights to future litigation and getting some of these settlement funds in return.
Got it. Okay, all right. So thanks for clarifying that, because that was a question that I had to try to understand my statement. So, as I look at it, I'm a little hard pressed to understand why, if the city is going to receive funding, and as you go through the MOA, obviously there's a lot of things there, treatment of opioid use, support people in treatment and recovery, and I'm just using, each section, connect people who help, and I apologize, I'm looking down because I'm reading at the same time. Section D, addressing needs of the criminal justice involved persons, addressing the needs of perinatal population, prevent prescribing and ensure appropriate prescribing, dispensing of opioids, prevent misuse of opioids, prevent overdose deaths and harms or harm reduction. And then other strategies, part 3, which I think is really important, is first responders, because I think the MOA outlines how the funds would be used, leadership planning and coordination, training, research, post-mortem, and then the Exhibit B shows the allocation by county. So, I would pose this question to the council members who I believe have previously voted no, so we're asking to reconsider. If the city of Burnsville decide, from a vote declines, any future litigation is just like anything else. We don't know what will happen. We don't know how anything would be decided in a court or with a jury in a civil litigation, or even if there's criminal. So that's one thing. Then if we say no, which I oppose, and I implore you to vote yes, then how otherwise under these circumstances would the city of Burnsville fund all of these things to address these issues? And that's a question to anyone on the council who wants to answer.
Yeah, Mr. Winter, after we hear from everybody, each council member will make remarks. And at that time, you will hear their position on this issue.
Okay.
Okay?
All right, thank you.
Does that make
Thank you.
sense? Okay.
Thank you, Madam Mayor. I appreciate that. That does make sense. I was just trying to cut to it. So I think in short, and those of you who know me, I'm not really succinct most of the time, but this is a really passionate issue, I think, for our community. I myself deal with some chronic pain, and some of it is the natural process of aging. I don't know of anyone that I've talked to or spoken to, and I have friends who deal with chronic pain, live in the state of Minnesota. I've been here, I think, 18 years, was ever declined access to an opioid. Now, why is that? Probably because we had some really responsible doctors, who monitored our use and was trying to find the best. And I think there was a lady who spoke earlier that talked about toolbox. So I have my own experience and with other people that I've talked to about this. And then on another note, you know, there were some statements made, and I think we all need to be careful about generalized statement, including myself, when we say, well, alcohol or X is the gateway drug, because, again, and I know people question the CDC, but the CDC has puts it some outline, and there's lots of research out there, and researchers don't agree, just like, no pun intended to the city lawyers, but sometimes lawyers don't agree. Even on the same side of the fence, is that there's a lot of circumstances that are weighed when we try to determine why one person would have an addiction versus the other. So I think we all need to kind of look at that and question, because, you know, for example, we don't know what anyone in that room may have been dealing with and how they led if they had an addiction, or how, again, you know, some of the folks compassionately spoke out about chronic pain, which I can understand. And so I just wanted to make sure that was highlighted. We need to be a little more circumspect. But again, I would say, I think not accepting the funding, then you have to say, okay, well, if we don't accept the funding, and there's language that I probably think we would all agree in this MOA that we wouldn't particularly care for. But at the end of the day, then we go, okay, well, we have the problem. It's not going away. COVID has exasperated it. How would we otherwise fund these programs to be able to address the issues in our community and our surrounding communities? You know, as we have lots of neighbors that border, and they're part of our community as well, even though they're not necessarily a Burnsville resident. So that's all I had. I appreciate your time, and thanks again for having me on. And I appreciate the city even taking up the issue and putting it out to debate and listening to the residents. Thank you.
Yeah, thank you, Mr. Winter, for taking the time and speaking to us and sharing your thoughts. Really appreciate it. Thank you. Okay. Do we have anybody else on queue?
We have one more now.
Okay, okay, and that is
Terrence Jacobs.
Karen Jacobs?
Terrence?
Okay. Okay. Are we having problems? Okay. Mr. Jacobs, good evening.
Good evening.
Good evening.
Mayor and
Please
council
give us your
members,
name and address for the record, sir.
Of course. 13632 Crestwood Drive, Burnsville, and that's right by the hospital.
Yes.
I spent 35 years of my career in the healthcare business on the equipment side, sold ventilators, sold chemistry analyzers. I've been at bedside. I've watched people die. One particular incident at the Cleveland Clinic that I experienced will never leave me. And that was an 18-year-old young man who was in and out of the Cleveland Clinic pediatric intensive care. And his problem, of course, was an opioid addiction. And it affected me in such a way that it caused me to pick up the phone and actually speak to a particular relative of mine who was a member of a company that is one of the litigants. And after that chat we had, and after I found out what the issue was surrounding the litigation we're talking about, I decided to sell my stock in that company, and she stepped down from her position in that company as well. And we are at a point here where we're discussing two different things, I'm afraid. One is the funding of a future that we could have. And the other one is, of course, the aspect of the law and how it is currently written. My attitude towards this is, with the help of some of the speakers tonight and others that are in my congressional district, in my state district, I think there's an opportunity to make some changes in the law and help those who need help. And at the same time, we can certainly use the funding in a smart fashion, fashion that response in a way that will indeed help those who need the help. I see no legitimate reason to walk away from the funding. I certainly understand why this has happened. And I understand, the Sacklers of the world and what they've done, and the Cardinals and the McKessons of the world and what they failed to do, and a few, really poor physicians and their interest in income producing prescriptions. So we're at this point, and I congratulate the City Council for bringing this back up. I also appreciate the people that highlighted it and gave it another life, because indeed, if we really want to make this work out for everyone, and I certainly would hope that the people that are suffering from pain, my daughter suffers from fibromyalgia, and quite honestly, I see her debilitated once in a while. I don't know if opioids will be the answer, but she's got good care. I think there's no reason for us to say no. I just don't hear it. And if there is a reason to say no, then let's change the law and have that fire start right here in Burnsville, and be proud of it. There's nothing wrong with leadership. And I encourage each one of you to vote yes. I'd like to see across the board voting yes on this. Thank you for your time, and appreciate the opportunity.
Thank you, Mr. Jacobs, for your time, and thank you for sharing your thoughts. Okay, and I'm watching our time, and I know council members want to make remarks. So the last speaker is Mr. Cantrell. Please come forward. Who? Oh,
Yes, please. I defer to the humble senator from Burnsville.
okay. Senator Port, okay. I'm trying, Senator, to try
I
and
will be
manage
very brief,
all of the
Madam
stuff
Mayor.
that's going on here. So, welcome.
Thank you, Madam Mayor and council members. I just wanted to say thank you to all of you for for bringing this back up so that the community could have a conversation about it. I think that you have achieved that tonight, and that is not always something that is guaranteed in politics. So I commend you on that, and I thank you for taking your time tonight, and also to all of the residents that showed up to tell their stories and input their opinions. I appreciate all of your time. I just very briefly want to flag, certainly if there are questions about the actual wording in the settlement or the Section F portion, that there are members from the Attorney General's office in the room tonight who can be asked any of those questions, and they'll be able to answer those clearly and quickly, I imagine. But I encourage you to vote yes. I think that we can put these resources to good use to help our communities, and I thank you for taking your time tonight.
Thank you, Senator, for taking the time to talk to us. And, she said that, Mr. Kintrell, I'm going to call on Mr. Maloney from the attorney.
Please do.
Yeah. Because there are some things here with regard to Section F, and I know that, I am so proud of Representative Baker, who has traveled all the way from Wilmer to be here because it's an important subject, and has sat through all of this. So I know that you've been working together. But Section F and the things that we need to change so that those who are living with pain are heard. But for us to move forward with what the settlement is about, we need to make sure that we continue to, as Representative Baker has said, we can always do better, so let's do better. Okay.
Madam Mayor, if I
Yeah.
can ask him a question?
Yes, please.
Are we able to change Section F?
So there are two things in the MOA, and so I'm a lawyer, so forgive me for being kind of technical on this, but the beginning of Exhibit A in the document does say that this is an ongoing, evolving list, because of course, as practices change, science changes, medicine changes, so there is built-in flexibility in this list to be updated as time goes on.
That's what I thought.
The agreement also says that it can be amended.
Yeah.
So it is not a completely set in stone document. There are, I think, those two, ways to update it.
And that's what I thought when I saw that it can be amended.
Correct.
And that's when I liked what I heard from Representative Baker, that you continue to work on this. And then there's the Buurman bill that you're going to look at. And then I'm sure that you all will take a look at that, and it'll address some of the issues. Yeah.
May I ask one more
Yeah,
question?
absolutely.
So in F, these are core things. These are not ancillary things like you may do this, you may do that, you could have this type of program. These are absolutely core things, such as citing that you're going to be going by the CDC guidelines. So are you saying that we would just say, oh, nope, we're not going to do that? That's absolutely a core thing. So that's my question on that. That doesn't seem to me that that's something that would be changed. Similar to supporting enhancements and improvements in the prescription drug monitoring program, which that is a core thing that Minnesota is doing. So the idea that we would then change this to say, nope, we're not going to, I have trouble thinking that that's the case.
So I have two thoughts on this. So one is, to the question about is this a core thing, I think the entire list is, these settlement funds are dedicated to be spent to remediate the opioid crisis, right? And this is a long list. There were experts involved. This is a national list that we kind of drew this from. And it is one of the items on a 13-page long list. So to call it core, I don't know if I would agree to call it core. It's on the list. But the list is a menu, right? So what Dakota County is going to do, what Minneapolis is going to do, what Jackson, Minnesota is going to do. I mean, I think every county and every city, and this is true for ORAC too, as they do their work. We set this up where there is local decision making about what your community needs to fund, right? So it's not that because it's on that list that you have to do it. It is up to you all. I mean, you will be here, making those choices. It'll be up to you to pick from that menu as to what makes the most sense. Not required, not mandatory, not core. One of the options on the menu. Point two is on the CDC guidelines. My understanding is that they're currently under review and being updated.
Yes.
So, and that the language in the document doesn't peg it to a date. I think it is talking about those 2016 guidelines, but again, as the science evolves, right, I think these things can be updated as the science gets updated.
Okay.
And that is also part of the difficulty because the current ones are awful. And we don't yet know what the updated ones will be. So we're asked to either agree with something that's awful and isn't working and is recognized as not working because they're rewriting it, or agree to something that we haven't seen. that's difficult.
So I think the intent here is not to lock us into 2016, lock us into 2022. I think the intent of this, and I mean, I'll take, the blame or the credit for this because I think our office, wrote this document. The intent of, both this list and the national list that it's drawn from is just medical education and making sure that Minnesota is up to date with the best practices, right? And that's whatever that might be, and it's not meant to, I think, lock us into a formula or into a certain document. It's meant that we have the best practices for Minnesota, as determined by those here can make that determination. So, it's not meant to be, I think, prescriptive. I mean, I know that it's referenced there, but I think the intent is, to have medical providers, have the best education that Minnesota can give them as to appropriate prescribing practices.
And I do understand that, and I'm hopeful that time allows because I have the examples of what Minnesota's education is. It's not pretty. And so that would be nice for us to be able to look at.
Understood.
Mr. Maloney, thank you for you and your colleagues sitting through all of this. And my hope is that you will continue to work with Representative Baker and the others, and so that we can get at addressing the pain issue for the people who spoke this evening, but also making sure that we look at the issue of the opioid addiction.
Absolutely. Can I make one more point just based on, I think there was a question tonight about what happens to the funds if Burnsville says no?
Yeah.
So I can just very, very quickly. So Burnsville's share of the settlement funds, if we get full bonuses, $1.1 million. If Burnsville says no, the state of Minnesota as a whole, kind of like our whole, the funding stream that's coming in, loses $1.8 million. And that $1.8 million just goes back in the company's pocket. Doesn't go anywhere else. It's just, they just get to keep it. So that's the result of Burnsville saying no.
So it goes back to the company.
Correct.
Yeah. Okay.
Thank you very much, Madam Mayor.
One moment, Mr. Maloney. There's.
Actually, I have a couple.
Councilmember Gustafson has a question.
Is there anything about this agreement that prevents doctors from prescribing?
No.
Can you tell us more what the money can be used for?
Absolutely, sure. I don't have the list here in front of me, but we've talked about this Exhibit A to this. We call it the MOA, but it's basically just our state and local government agreements, and we have a 13-page long list of things. It's prevention, education, treatment. You heard from Mr. Kindy. There's a lot of different things that are on there because this is such a broad-ranging crisis that just hits, kind of almost every facet of modern life. So it is a long list that really does encompass a lot of different things to kind of fight back against the crisis.
Thank you. One last question. Should Burnsville not participate in this, will that change that MOA?
Will that change the MOA insofar as will the language be changed or no?
So nothing changes if we say no?
No, I mean, I think it'll be disappointing. I think that the state of Minnesota will have, $1.8 million less as a whole, but the document itself will move forward and, I think we'll be forced to move ahead without having Burnsville as a partner in this, which I think would be too bad.
All right, thank you.
Yep.
And
Thank
as you
very
said,
much.
the money goes right back to the company.
Correct, Madam Mayor.
Yeah.
Yes.
Thank you, Mr. Maloney.
Thank you.
Okay, now I'd recognize Mr. Cantrell. You've been patient. Now,
Okay, well, so I'm going to speak on behalf of yeah.
Okay.
Thank you. All right, Madam Mayor, City Council members, it is a pleasure to join you this evening. Thank you so much for taking this issue under reconsideration. I know I speak for everyone here when I say I appreciate your service to the community and for your very thoughtful consideration of this issue. My name is Hunter Cantrell, and I'm a former state representative, and I am here representing Dakota Child and Family Clinic as a member of the Board of Directors, address 2530 Horizon Drive, Burnsville. Our clinic provides a wide range of health services to those who need them, regardless of their ability to pay. Needless to say, the money from this settlement is urgently needed. As you just heard from someone from the Attorney General's office, the money goes right back to the company's pocket and nothing substantively changes in terms of policy. The city would be giving away money that could absolutely help the patients that Dakota Child and Family Clinic serve and help Burnsville citizens as a whole. As opioid addiction resources are always needed, and they always need more funding, particularly at this time when rates of addiction have increased in our community, among our patient population, and throughout the state of Minnesota. This money is absolutely critical. I would like to share the following letter with you all from the practitioners at Dakota Child and Family Clinic and the executive director. Opioid use and misuse have reached a critical level in our country and in our community. In 2019, Minnesota ranked 11th in the nation for overall opioid overdose deaths and was number 1 in the nation in opioid deaths among indigenous communities. Record deaths from opioid overdose were reported in 2020, including a 30 to 39.9% increase in opioid deaths in Minnesota, fueled in large part by the ramifications of the pandemic. In Dakota County alone, the number of deaths from opioid overdose doubled from 2018 to 2020, and the number of non-fatal overdoses increased by 140% from 2016 to 2020. The greatest number of emergency room visits for opioid incidents occurred in the age range of 15 to 24 years of age. The rate of opioid misuse and abuse in 8th grade children in Dakota County has doubled from 2016 to 2019, with no end in sight. These are statistics that we can neither be proud of nor ignore. Death and near deaths are not the only effects of opioid misuse. Neonatal absence syndrome, found in children born to mothers who have used opioids during pregnancy, has increased by 16% since 2018. These infants require intensive treatment in the hospital and long-term follow-up with the families once the child is discharged home. Lifelong problems with behavior and cognition are common in children with neonatal absence syndrome, adding to the healthcare and economic burden in our community and straining our educational resources. As the largest community in Dakota County, you can improve treatment for opioid misuse and abuse for the citizens of Burnsville through the monies available from this opioid settlement. Monies, as others have said, is restitution for the damage that has been done by these companies. Healthcare providers in our community are overwhelmed with the lack of access to comprehensive, patient-focused, intensive treatment options for individuals who are at risk for opioid misuse and abuse. Of the 22 programs we reviewed in the Burnsville area, virtually none advertise acceptance for individuals without insurance. Providing funding for programming that supports community-based collaborative treatments that include public and professional education, including the free training Dakota Child and Family Clinic provides to train Dakota County jail employees on how to use Narcan. Access to mental health and medical case management for all, mentors and coaches to assist individuals with overcoming opioid dependence, and support for families of individuals with opioid dependence is necessary. We cannot overcome this crisis by ourselves. We are asking you to vote in favor tonight of joining the opioid settlement and begin the process of healing for the citizens of Burnsville suffering from the opioid epidemic. I thank you, Madam Mayor and council members.
Thank you, Mr. Cantrell, for coming in. Okay, I'm watching our time. We have a mandatory 10 o'clock, and this is the time for the council now to share their thoughts. And I'm going to go to Councilmember Workman, since he is on Zoom, and to make his remarks and his thoughts about the subject at hand.
I love going first. Before I start, is Miss Thornton still in the room?
Yes. Ms. Thornton is.
Are you Michael's mom?
Yes, I am.
Yes, she is Michael's mom.
I just didn't want to tell you that.
Will you tell him I said hi at a council meeting?
I will, and he told me to tell you how.
I didn't catch that. That's okay. I think there's a reason why city councils don't deal with these types of issues often or ever. And I would suggest to our state delegation that if they're gonna do something like this again in the future, that they just do it and not, ask us to participate.
Just,
Clearly, everyone has been impacted by prescription drugs, or illicit synthetic opiates in one way or another. That was made abundantly clear tonight, and there's a lot of passion and emotion surrounding this. Ugh. I'm not 100% on where I'm gonna land on this. One thing I learned when I was on the planning commission is that if we wanted the council to review something, it had to go to them on a split vote. It couldn't be unanimous, and I think we have 2 planning commissioners in the room that are aware of this as well. And so walking into this, you know, for most of the evening, you know, the intent was we've brought awareness to something that was not being discussed or even looked at by other cities, and seemingly have made an impact. And by continuing to hold the line and vote no on this could make a even more significant impact. But the attorney's words were significant, and so I guess at this point I would defer to my colleagues, because I want to hear a little bit more about what they're thinking, and where they're at on this.
thank you. I will now go to Councilmember Keeley.
Thank you, Madam Mayor. Well, first of all, thanks to everyone who has come out on this balmy January evening to tell your stories. They were moving, they were emotional, and very heartwarming. At times I struggled to hold back tears for those in pain. This is the most unusual city council meeting in my 15 years of sitting at this dais. When I ran for office, I certainly had no idea I would ever be sitting here listening to these folks with their stories of pain, listening to doctors, specialists, telling stories of being questioned, of whether they were making the right decision or not, what was in the best interest of their patient. Being asked to decide to take part in a drug company lawsuit settlement was definitely not something fathomable. We've heard from doctors, patients, legislators, residents, and more. Patients who have felt the struggle of access to pain relief want us to turn down the settlement because of the negative impact on the doctor-patient access to much-needed pain relief. Some doctors, legislators, and parents who've lost kids to drug overdose want us to accept the money to help pay for programs, education, treatments. On both sides, there is acknowledgement of the issues with the CDC and other agencies with confusing and convoluted information. And there certainly is an agreement that we have an addiction problem. Whereas we have unacceptable language that we cannot change, I'm glad to hear that it can be altered, that it isn't etched in stone. We also have clear evidence of cause of guilt by the pharma companies. We have good reason to reject this settlement because it's part of the problem instead of the solution. We also have good reason to join this settlement to use the money for addiction treatments. There are a lot of organizations that financially struggle because patients who need the help can't pay for the help. We are asked to have faith in our state legislators to fix the problem through legislation. I have no doubt the level of commitment that Representative Baker brings to this issue, as he has been a strong voice at the Capitol on many issues, and the loss of his son gives him a special reason to be committed to this until something is done. A bill that could have addressed this issue has been discarded for years. I hope that starts to move forward now that this meeting has taken place and the comments have been shared and publicized, and they're going to be replayed on our local cable access channel for months. I think this entire process should be shown to a lot of people, certainly the other cities in Minnesota. They should all watch this. Families should watch this. Teenagers should watch this. I'm concerned why nothing has yet been done for chronic pain patients. Why they've been given lip service for years. I cannot imagine what it's like to live with severe pain, to go get help and be told that you're a drug seeker, an addict, or you need to reduce your medication. That seems ludicrous in America. I'm concerned why doctors have been treated like they're not the experts, when in fact, they are one of the leading experts. I don't honestly know if there is a right answer to this question. I struggle to find solid ground on either side. I know some cities and counties in the U.S. have chosen not to join the settlement because they're going to go on their own and sue for a larger amount. How can this settlement help fix the problem? Will anything change if we say no? Will anything change if we say yes? My decisions have always been based on facts and truth and my values as a citizen of Burnsville who cares very deeply for my community. This is one I struggle to find justification for either answer. We're being also asked to make a decision after a long night of testimony, very good testimony. And I certainly would prefer to sleep on it and think about it and come back and have this discussion another day. That's what we do when we're making very big, broad, impactful decisions on the city. We don't have that luxury tonight because the deadline is tomorrow. The first time we took up this discussion, we didn't have any time, and then we did. I can only err on the side of caution and hope tonight's discussion will draw more attention to the problem, and each doctor and patient can have the relationship they should have always had without someone questioning their decisions. I am, like Councilmember Workman, very challenged on this decision because throughout the night, our last discussion today, I've been reading and reading and reading, and it is a difficult decision, to say the least. I'll reserve my vote till after everyone has commented. Thank you.
Councilmember Gustafson.
Thank you, Madam Mayor. And I want to thank everyone that's been here tonight. I want you to know that we've heard you. It was painful to hear of your pain and the troubles that you have getting your prescriptions. It's terrible. I think because of this meeting tonight, we have brought a lot of light to it. We as a council have done, I believe, as much as we can to help our legislators make decisions to make this a better agreement for all of us. And I certainly hope that they follow through and make that happen because I truly believe it's very important. Having said that, I also can't in good conscience ignore people that suffer from the disease of addiction. And we have to look at that side of it too. And if we can help prevent kids or adults with addictions in our city, we need the funding for that. I know our behavioral health unit, which has our chief put together a while back, and a wonderful job with that. It's underfunded right now. They could use a social worker. There's a lot of different things they could use over there to help with the community as a whole. And so, I mean, I will tell you now, I'm going to be voting yes on this.
Okay. Councilmember Schultz.
My comments will probably be a little longer.
When we get to the point where we need to, we can have a motion to extend the adjournment time.
Yes.
And we can extend it for an hour, and then we can vote on the extension, and if we need more, but we can
My legs aren't even working at this point. Where's the,
Sorry. Yeah, it's the same.
yeah, but I gotta look at that thing to
Yeah.
pull mine up and.
She's going to use the speaker's days. Staff.
Actually, I can bring my computer over. That'll probably just end up being easier instead of pulling that back and forth. Everyone just started crying because they see them settling in. Thank you. Appreciate it. Thank you. Appreciate it. All right, try to click through this fairly quickly. It has been a long evening. And I do appreciate everyone that showed up and spoke. That's what part of good governance is bringing people in so that they can speak. But I will also tell you that as complex as this has been, as confusing as this has been, as much as it has seemed to pit one set of patients against another set of patients, because people facing addiction have a chronic disease. And people who have long-term pain have a chronic disease. The reason why they're being pitted against one another is because we have before us examples of really bad policy and a settlement that has active harm towards one group at the expense of another group. And so it makes people pitted one against another. And that's how we know we are in the midst of bad policy and a bad language in that settlement. And make no mistake, it's not just that the language is like, not so good. The language promotes active harm to a group of people. And that's what I object to. So, we'll get underway here. Okay, so what are we deciding tonight? And it has seemed as the conversation has ranged back and forth, what the heck are we deciding tonight? We're deciding if we can really agree with the memorandum of agreement and sign on to the settlement. Okay, so let's just take a snapshot of Burnsville. Census, we have over 64,000 people. So what does that mean for Burnsville? It means that 643 residents are in active addiction right now to drugs or alcohol. 10,290 residents have suffered 4 or more significant childhood traumas, and that's going to be an important number coming up. Almost 13,000 have chronic daily pain, and of those, 5,140 have daily pain, which limits their activities. Over 16,000 residents in Burnsville are or will be becoming disabled for a year. So we are talking about huge impacts across our population. And we're talking about addiction versus physiological dependence. I'm not going to go into that too much. But how and when does addiction start? I mean, that's a mystery. That's what we're trying to solve. Because, as a person said, we have to stop pulling people out of the river. We have to find out why they're in the river, right? I'm on board with that. I am completely on board with that. Because this isn't just about a pot of money. Trust me, I'm in city government. I want your money. It's not about if we want to help people in need or not. We really do. Like, we all have consensus on that. Everyone that spoke, everyone here, we all have consensus on that. But with most settlements, you're just signing on saying, lawsuit is over, we won't seek damages, that's it. But in this one, they added that memorandum of agreement and added those areas into it unnecessarily. And that's why we're here. That's the step that didn't have to happen. That's the poison pill, if you want to put it that way. And trust me, I am not a farmer shill, so there's no love in my heart. But I am as deeply disappointed by that as all of you. And that's what I'm struggling with. And that's what my other fellow city council members are really struggling with. So when we look at addictions, 90% of them are going to start in adolescence and young adult years. That's when they start. We're not going to go into that part. We'll just skip over it. But what causes that? Why are children becoming addicted? What is causing that? So something we look at is ACE scores, which is Adverse Childhood Experiences. It's 10 questions that you can ask about their experiences in their daily life. Illicit drug use increases 2 times, which with each positive yes answer to those 10 questions. When you get to a score that is 6 or higher, they are 1,000 times more likely to use injection drugs, and that's a whole different ball game than smoking weed. 25% of individuals report 3 or more ACEs. That's Burnsville residents, so 16,000. 60% of U.S. youths with clinical level mental health concerns don't receive mental health treatment. So why isn't childhood trauma and budding addictions, why aren't they treated? Okay, it can be access, it can be insurance, location, all those kind of things. But the biggest barriers are actually perceptions of mental health and perceptions of those services. And that's out of parents who are seeking help for their children. But the biggest reason why there's not treatment for childhood mental illness is because parents are not seeking help for their child. And I'm not blaming those parents because there are barriers. There's misconceptions of resilience. We go through situations where us parents are crushed, can't even function. But we think our kids will bounce back. They don't. They're experiencing that same thing. They're struggling, but they don't have the language to even say how they're struggling. Parents may be afraid that their children are going to be stigmatized for the rest of their life, labeled a head case. They don't want that for their child's future because maybe they'll grow out of it, or maybe a miracle will happen, or maybe it's not as bad as I think. And they worry that they themselves will be stigmatized. Who wants to be known as a crappy parent? And that's with mental health or addiction. No one wants to be known as a crappy parent. They don't want that view. They don't want to feel compelled to pay for their child's treatment. And I'm not talking that they're like cheaping out. It's expensive. A lot of mental health and addiction is not covered by insurance, so you are paying out of pocket. It's a horrific expense, and they know that. They just might not have it. But also, parents may not wish to face up to the reality of the situation, which leads them to enter into denial. And how this denial works many times with either addiction or childhood trauma is they try not to see it until they can't see it anymore. And oftentimes, because it's so overwhelming and horrific, it's hard for them to face. And they don't have the tools for how to face it. And sometimes what's happening is a child is really struggling. They have addiction, but it's not noticed until it's wildly out of control and has escalated into other drugs. So when we look at chronic pain patients, so that's just pain that lasts longer than 3 to 6 months. It's a large umbrella category. It covers many different things. But 100 million Americans live with chronic pain. 40 million have severe pain. 20 million have pain that regularly prevents life and work activities. And it's the number one reason Americans go on disability. So if we want to talk costs, $635 billion is lost in direct, not indirect, direct costs every year. It's the second most common reason people kill themselves. And the CDC has acknowledged that suicides increased due to unmanaged pain resulting from the misapplication of their guidelines. Now, opioids are not typically recommended as the first line of treatment, but for a subset, it's all they got. These patients don't want to be on it, but it's all they got. It's the only thing that's working. And that's 8 to 13 million people in the United States. This is not an insignificant number. When we look at drug overdose, most of the time it's multiple drugs in combination. The average number of substances in a person's system who dies of an overdose is 6. And opioid prescribing in the US has fallen since 2012, while overdose deaths have climbed by 57% in that same time period. Deaths from fentanyl, illegal fentanyl, are up 1,000%. When we look at, and this is a Cochrane review, which you can't get better than a Cochrane review. This is your gold standard. Less than 1% of those who are screened for a prior drug problem developed a new addiction during pain care. Drug-related deaths from overdose who take long-term high dose, so we're in the extreme category, is 0.0022 per 1,000. When we look at, and this again is from national, we look at 87 million non-institutionalized, which means they were taking these drugs not in the hospital. They were administered at home. Prescription pain relievers. The number of unintentional, non-heroin or fentanyl overdoses was 0.1% of the population taking prescription medication.
Councilmember Schultz?
Yes.
I'm going to ask for a vote to extend the adjournment time. May I have a vote to extend for an hour?
I move.
Do you need a motion?
Yes, I just, yeah.
She moved, I'll second.
Councilmember Kira, and there's a second. All in favor, please say, oops, we need to do a roll call.
Gustafson,
Aye.
Couts,
Aye.
Healy,
Aye.
Schultz,
Yes.
Workman.
Aye.
So it's to 11 o'clock. Okay.
Thank you very much. To put this into perspective of what the risk is, the mortality rate for prescription opioids is comparable to the risk of taking daily aspirin for 1 year. So if prescription pain medications aren't the problem that we're seeing, well, why do we think that they are the problem? One reason is we have some very dedicated people who are advocating for people who need it, and those are people facing addictions. They deserve those advocates. But when those advocates tried to get all of us to acknowledge the problem and help, the response we gave back to them was, good, I hope those junkies die. They're trash. They're garbage. They need to buck up. That was the response they got. But when the narrative was, we have people who are becoming addicted to prescription drugs that was prescribed to them by a doctor, and that could happen to you too. You could have a car accident, you're prescribed long-term, then you're addicted. The response was wildly different. It was very compassionate. People wanted to be involved. They wanted to help. That isn't saying anything bad about the addicts, and it sure isn't saying anything bad about those advocates. That response is saying something bad about us. That we could not feel human decency until we got a story we liked. That's horrible. We also have doctors who are looking for better pain management. They realize, yes, in the 90s, there was a lot of prescribing. It needed to be dialed back. And we can't just cure it with a pill. There's got to be other things. So they were pushing for all these different things you hear, like, you know, things that now we're like, well, of course, like acupuncture and, you know, yoga and stretching and physical therapy and biofeedback and psychology, all of these things. Those are positives, and that's good. Of course, we also have pharma capitalizing on the market. From back pain alone, Americans spend over $3 billion just on back pain. So there's money in it. This is also a really difficult and complex interplay of multiple things, which we've heard over and over tonight. Humans don't like difficulty and complexity. We like simplicity with a villain and a resolution. We like that happy ending. I'm not going to make that joke. So, there's also money. If you have politics involved in anything, there's going to be money involved in it. Now, I know some people took offense to me saying lining up at the trough. I'm not talking about you guys. I'm talking about politicians. That's what we do. That's part of what we do. Some of it's good, some of it's bad. But that's the life's blood in politics is money. And that's the reality of that situation. And there is a lot of money in this in multiple ways. So why aren't we hearing more up until now? Because so many people were surprised by what they were hearing. Because doctors are being threatened, and they are frightened, and they are being silenced. The monitoring programs that we have flag them, and they flag them for even something as insignificant as a patient has constipation. You can be flagged by that and have your files reviewed, because that might be a sign you're overprescribing. But that's a super common side effect that you can even just take one pill and have that side effect. But they're watching for how much are you prescribing? When are you prescribing? Who are you prescribing to? How many patients are you prescribing to? And as more and more doctors kick their patients off, they just dismiss them so they can get under these limits, other doctors are taking them, and it pushes them into being outliers. And then they become under scrutiny. Doctors can not only be disenrolled from Medicare and Medicaid, they can be decredentialed. Their whole career that they see as a vocation can be wiped away. But even more fun, because our state does have this, they can face civil asset forfeiture, which means you don't have to be charged, you don't have to be convicted, but you can be looked at for a suspected drug offense, and they can take your house, they can take your car, they can take your business, they can take your medical files. Do you think that that would frighten you? We have doctors regularly getting a monthly nastygram that says, get under this amount. You have to not have so many patients taking pain medication. We're going to put you on a performance improvement plan with the state. Now, I don't know about you, but when I've been employed, and my boss told me he was going to put me on a improvement plan, I knew I should dust off my resume, right? You're on your way out. And they know that. We've also heard, and that was what Cammie alluded to, patients are being silenced. We have seen several times now that we have patients advocating for themselves and their fellow patients, and they speak before the state senate, they speak before our state house, they give interviews to the media. And immediately after, and I mean within 24 to 48 hours, they're alerted that they are being removed from their pain program. Because that interview or that speaking up was labeled drug-seeking behavior. You only have to have that happen a few times in a community, and people get the message. Shut up. Don't say anything. And once government actions and laws are enacted, they're really difficult to reverse or fix. You know, attorneys a lot of times talk about, and this is usually more in criminal, once you're in the jaws of the beast, it's gonna keep grinding away at you. So if you wanna know if government will take an action in the future that is beneficial to you, it's helpful to look at how they have behaved in the past. And how we have behaved in the past has been pretty horrible, which you've heard over and over tonight. There have been multiple opportunities to fix this before this ever hit our city council, years. And it didn't happen. So we have some simple narratives, but some really dangerous misconceptions that undercut this. This makes me physically ill to even contemplate. Half of the surveyed medical trainees reported a belief that Black patients can't feel pain like the rest of us. They agreed that Black people's nerve endings are less sensitive than white people's. Black people's skin is thicker than white people's, and Black people's blood coagulates more quickly than white people's. These are our medical trainees. 20 years of studies have shown that Black and Hispanic patients are less likely to receive pain medication for acute pain in the ER. 4 million Americans have chronic pain due in part to racial discrimination. Black patients report higher average levels of pain, but in 90% of our US healthcare systems, they receive significantly lower doses of pain medication. We also have gender bias as well. So in the 1990s, yes, doctors were encouraged to aggressively treat pain, and so we saw a rapid rise in prescribing opioids. We did. And people who were addicted already, especially, were able to get prescriptions easily. And they knew what they were getting. That was way easier than going on the street, so they did. In the 2000s, public health agencies and doctors urged more caution when prescribing, and that's when you started to really hear multimodal pain efforts start. In 2013, the AMA, the National Association of, dang it, I knew there'd be a typo, Boards of Pharmacy, the Federation of State Medical Boards together created guidelines which decreased prescriptions by 22% between 2013 and 2017, and this was prior to any government legislative or regulatory action. They were aware of this. They were talking about it. They were correcting it. So now we get into government overreach because we're really good at coming in late on a problem and then using a sledgehammer instead of a fly swatter. So in 2015, the Minnesota legislature passed that bill, I'm not gonna read it, authorizing that they do the opioid prescribing improvement program, and that formed the opioid prescribing work group. It was made of 14 members. So this is back in 2015. Did not include a pain management specialist doctor, did not include a chronic pain patient, did not require the group to examine impacts on patients from the consequences of their actions and guidelines. So we're talking about past government actions so that we can judge what they'll do in the future. 2016, you hear the CDC guidelines. They're supposed to be voluntary. They're not prescriptive, right? It's not meant for established patients. It was only a guideline for doctors to use for new patients. At that time, 28, ended up being 36, state legislator and administrative agencies took them and started to implement them more as mandates. And Minnesota is one of those states. 2018, Minnesota Opioid Prescribing Work Group releases the opioid prescribing guidelines. These guidelines place limits on prescriptions and they red flag doctors who prescribe outside, and then the doctors start receiving warnings. So in 2019, already declining prescriptions dropped by half. Patients were dumped. Access to health care became difficult. And I'm not talking about pain management. I'm talking about them being able to get a doctor, period. This is what it looked like in Dakota County with our opioid prescription rates. You can see that big jump down right when the work group put those guidelines out and started enforcing them, and doctors started getting letters. So in 2019, CDC warned state and state agencies, do not put these hard thresholds on. Do not codify these recommendations into law. They also acknowledged the misapplication and said that it's increased suicide rates and resulted in negative patient outcomes. In 2021, CDC announces that it's going to revise the guidelines. We'll get those in late 2022. And in 2021, with those pain patients who, after years, we finally were going to get 2 on, right? But only one of them ended up being really a pain patient, and the other was an addiction patient. And they were brought in, and they never got to impact, and they didn't get to do votes. The Minnesota Opioid Prescribing Work Group was disbanded. 2015, all the way to that time. So the consequences is the pain is no longer managed. We have increasing disability rates. We have that stigma and shame that people are fighting through. Because when they advocate for themselves, that's labeled drug seeking, whether that's happening in the doctor's office or outside. They're having difficulty receiving health care, and I mean any health care. 50% of your general practitioner doctor will not accept a patient if they take opioids. You can't get health care. We have dangerous and abrupt ending of medication. For pain patients, they go through pill counts, they go through drug tests, which, by the way, that's out of pocket. They have to go through other treatments, which also is most of the time out of pocket. And they're treated as if they are addicts. It's not a trust relationship. Many times they're forced to have painful and invasive surgeries and treatments. Even when those fail, sometimes they're made to repeat them. If you can get a doctor to prescribe, the pharmacy can tell you no. And depending on where you are and what your agreement is, you may only be able to go to one pharmacy. So if they tell you no, you're done. And we have our patients threatened into silence, and our doctors threatened into silence. I have doctors that contact me whenever this type of subject comes up from across Minnesota, and they tell me, I would love to speak out about this. I can't. I absolutely can't do it in public. I'll put a target on my back and I'll be done. I've only got a couple more years and I'm just gonna retire, I'm getting out. So the consequences we are seeing is opioid daily dosage was cut in half for palliative care cancer patients. We know that because we monitor the amounts. So we know that. Half of those surveyed said their physicians told them, I can't do that anymore. We have these laws and guidelines. I can't. I've got to get under my number. The American Society of Clinical Oncology said that 92% of U.S. oncology practices are worried about the restrictions on opioid prescribing for treating cancer pain. At the International Cancer Conference, experts were discussing the care that breast cancer patients in the United States were receiving. And as far as treating pain, it was under-happening at a level that in the same breath they were comparing it to the level of treatment in third world countries that aren't treating the pain because they simply don't have the medications. We get to the physicians being reluctant at 81% or unwilling, 40%, to treat pain patients who use opioids. That's any healthcare. We get into forced tapering, and Representative Baker did bring this up, and I know this is a particular concern of his. When a doctor realizes that they have to get under a certain limit, they will crash a patient down because they're on an improvement plan and they're going to be looked at in 30 days. So instead of a long tapering, they're going to crash them down. So when discontinuation happens abruptly, half of those cases are in the ER. When you change a patient's dose, when they are on a stable dose and you change it, threefold increase of an overdose death because you've destabilized that patient. Forced tapering happens most often to women and persons of color, veterans. And the kicker to this is, once that doctor gets them, crashes them down, they dismiss the patient. They dump them. So all of that happened to them, and then they dump them. So we're looking at these numbers, and we see that the numbers for prescribing have gone down. We see that big jump right when Minnesota's specific prescribing guidelines go down. This is the overdose deaths. Prescribing, overdosing. These are putting it together with the dispensing rate and the overdose deaths. But let's take a look at those numbers. So when we talk about the overall deaths and the numbers, that red that's skyrocketing up, that's fentanyl. That green underneath there, that's meth and Adderall, those types of things. We have benzos, we have other opioids and methadone. That's the category where maybe it's prescription, maybe it's not, but a huge percentage of that is methadone, not really used for pain. And then we have heroin, cocaine. So we'll look at those numbers. So in 2020, total overdose deaths were 1,106. Of those, 221 are suicides. Absolutely sad. We don't want that either. Any type of opioid, subgroup, 654, right? That's where the conversation usually ends. And everyone was left with the idea that those 654 opioid deaths are prescription opioid deaths. But we're going to look at those. Of those 654, 539 were illegal fentanyl. 117 heroin. When we look at the category where it could possibly be a prescription. That's the 206. But again, it's really heavy in methadone. Perhaps a prescription, perhaps not. Don't really know. Is it a counterfeit? Is it not? Don't really know. We don't know. This is the problem with our data and our decision making. When you have bad data, you can't make good decisions. And this is what we're really struggling with. And you notice those numbers don't add up, right? It could be multiple drugs in the system, right? Because overdose is multiple drugs. Okay, so if you have someone that has methadone in their system, and that is a prescription, they go in, but then they take something else. Maybe they took fentanyl, maybe they took heroin, might have took a speedball, could have done a benzo, you don't know, right? That counts multiple categories. So it count in each of those. So when we are talking about these prescription drug overdose, the only possible little category is that 206 of that subcategory, which is sad enough, but we don't know that it's even prescription drugs, or that it was their prescription, or that it wasn't methadone. We don't know that. Then we have our lovely pandemic, which, is like that dog sitting in the cafe that everything's on fire, and he's saying, this is fine. That's what we got, right? This is fine. We had a 27% increase in drug overdose in Minnesota. Almost every one of those was a fentanyl increase. This is from Minnesota Department of Health. We had the 59% for the opioid subgroup. Fentanyl increased 81%, and we're involved in 82% of all opioid-involved deaths. And then we have our non-opioids. Okay, psychostimulants, that's meth. Usually when you hear that, you're like, okay, that's meth. Increased 44%. Benzos went up 70%, and cocaine increased 41%. So we need to rethink our understanding of the problem. We need to differentiate between the overdose crisis, which involves, a much wider range. We need to stop equating pain medication with addiction and stigmatizing people and putting these two groups to fight. Because that's not fair to either group. We need to look closely at all the proposed policies and reforms to address the opioid crisis. Tougher action isn't always better. And our current policy approach to address addiction, because we've pit these two groups together, and we shouldn't have, and we don't need to, means that in our attempt to help 2.5 million Americans who are hurting, we're gonna hurt 50 million people. And you know what? To help the 50 million, we shouldn't hurt the 2.5 million either. So that was a long way to get you to, why do I disagree with this settlement? Because again, that's the question involved. It's not, should pain patients have medication? It's not, should people with addictions be treated? Those are both yes. And we all have consensus on that. Yes, absolutely, we should. So as I said, normally in a settlement case, when you're signing on, it's basically, yes, I will sign on, I will drop my claim, and I get a portion, thank you very much, the end. But that's not how they structured this one. They structured it in a specific way. And so when we sign on to it, we are signing on to that particular structure. And it is disappointing to me that that was added on there, in my mind, unnecessarily. It's as disappointing to me as it is to all of you. So when we look at that section F, which is primarily the area that we're focused on, it's not just that there's not good language. or language that could be improved upon. It's language and actions which actively hurt other people. And we know that because it has been hurting them through those particular policies. And it is worded in a way that we will either continue that or increase that action. And I can't agree to that. I can't say that that's okay. And it wouldn't matter if it was $1 and it wouldn't matter if it was 100 million. It's that ethic of it that I really struggle with. It's that we have this false narrative that is comforting because it's simple and we have a villain, but it's not getting us closer to making sure people don't fall into the river. We're nowhere near closer to that until we really focus on that childhood screening education that we do. So when we look at it, it's talking about the guidelines. Yes, I absolutely object to that. And I don't just object to it. The CDC is objecting to their own guidelines. The AMA is objecting to their guidelines. We don't even know what the new guidelines are going to be when they write them, but we're supposed to say we agree with them. Well, I don't, and I'm not going to agree to something I haven't seen. Second, it states, training for healthcare providers providing safe and responsible opioid prescribing, dosing, tapering of patients. And this sounds really reasonable until you see what Minnesota policy has in their Minnesota opioid prescribing guidelines that states opioid analgesics should not be used to manage chronic pain. That's the education. Providers should avoid initiating chronic opioid therapy. That's the education. So in the background, we have letters from the National Council of Independent Living. And they wrote, we are seriously concerned that the 2018 Minnesota opioid prescribing guidelines further misapplication of the CDC guidelines for prescribing opioids in chronic pain. And they address their problems with it, with opioid analgesics should not be used to manage pain. And they say, whether pain is attributed to non-receptive stimulus or centralized sensation, experts in pain medication acknowledge some patients benefit greatly from long-term opioid therapy. And they note a statement by a state authority saying that opioid analgesics should not be used to manage chronic pain incentivizes providers to reject or dismiss vulnerable patients from care. That's bad policy, and we're seeing the consequence of a bad policy. And then this settlement is asking us to say that we agree with that and want it to continue, and we want those funds to be used to do more of that. And I don't agree with that. They also say, while evidence supports the recommendation to avoid long-term medication as a frontline treatment, there's a small subset of patients with incurable chronic or neuropathic pain for whom benefits of opioid medication outweigh the risks. That seems more reasonable to me. I would hope it would seem more reasonable to you. They're also really concerned about the dosing thresholds. And they're noting how those policies are having real-world implications, and you need to stop that, end that practice. When we have the National Pain Advocacy looking at the same thing, they were saying, oversight in the current policy environment, such a statement, and they're talking about that statement, may be insufficient to deter forced tapering. In this environment, it's important to consider how a guideline is likely to apply by subsequent actors. In Minnesota, quality measures in the Minnesota Opioid Prescribing Improvement Program may undermine the good intentions set forth in the tapering guideline. Specifically, OPIP refers providers for quality improvement based on the number of their patients on long-term opioid therapy and by the number of their patients on doses above 90 MME. That's talking about policy. Policy that's harming people. When we get to the AMA, and they did their resolution 235, and they voiced their concerns. They noted that 22% reduction. They noted that their industry knew there was a problem and that they made those reductions voluntarily, and they did so before there was any regulatory action. They also note their extreme concern about the actions taken and the threats taken against doctors. And they are asking that that not happen. They oppose legislative and other policies that arbitrarily restrict a patient's ability to receive effective, patient-specific, evidence-based, comprehensive pain care, which is what Councilmember Keeley was talking about in, we don't want to keep interfering in that relationship between doctor and patient, but we continue to do so and we push it harder and harder. And when we sign on to this memorandum of agreement, we're saying those are the things we agree with and we wish to continue and we hope are funded. The concern also is some of their phrasing where they say including but not limited to. Now I know that's to give some flexibility. The flexibility is not always like on the good side of angels. It also means when you sign on to something and you agree to something, they can change the terms without you knowing what they're gonna change it to, or increasing things, or doing things you may not like. That's always a concern. I'm not gonna get too ramped up about that because I know it's like typical legal speak, but it is something to be concerned. So every session, there was an amendment introduced, bills introduced to limit the worst impact on our most vulnerable, the subset of the subset. And year after year, session after session, they couldn't get a hearing. Does that sound like a responsive government that understands the situation? Year after year, they introduced, and we pushed so hard for this, to get a seat at the table, to have pain patients and to have pain doctors who are specialists at the table. And we had to push and push and push for it. Does it sound like good policy to exclude those stakeholders, the key stakeholders, the most key stakeholders in all of it? Does that sound like entities working in good faith that you can build a trust relationship with? This is why I'm saying my trust level is low. I would need to see something before I'm willing to take the jump. And I don't think that that's unreasonable based on years of interaction. So we are being asked to perpetuate multiple lies and false narratives, which have caused great harm and suffering. And we're being asked to actively participate in continuing that harm. So when people ask me, why can't you just take the money? You could do something good with it. And I do understand that line of reasoning. That's an ethical dilemma that you struggle with. If you receive money and it's tainted money, can you make it okay by doing something good with it? And that's something each person kind of has to decide, right? That's your own ethical dilemma. And that's an ethical dilemma that we're looking at. And for me, the answer on this is the harm is so great. It's been so egregious for so long that no, I can't. And we're being asked to sign on in support of policies which pit chronic pain patients and their doctors, one side, against persons struggling with addiction and the full force of the state of Minnesota. And this is destructive, and it is divisive, and it is disastrous for both groups, for our community, and for our entire state. So yeah, we're being asked to sign on to the settlement, sign on to the memorandum of agreement, and that's the question before us. From past behavior, and for the reasons that we've seen, I will not be changing my vote this evening.
Thank you. Councilmember Schultz. We have heard from our council members, and before I make my remarks, I'd like Mr. Eric Maloney to come forth. The whole issue of Section F,
Yes, Madam Mayor.
if you can address it, because it seems to be an area where people are focusing on. And I also know that we need 4 votes tonight.
Mayor, we needed 4 votes for the extension of time. We just needed
Simple,
on those.
that's, yeah, simple majority, that's what I thought, it was a simple majority, and so when you set the code, it was 4-2 for the extension of time. Yeah, so we need 3 votes tonight for this. And just speak to, because one of the things that I'm always hopeful is that we are all caring and compassionate human beings and understand the challenges that are before us, whether it's those who have an opioid addiction or those who are in chronic pain. And tonight we have highlighted some of the issues that need to be addressed. But if you can speak, because I read that there could be an amendment on a lot of these.
Yes.
And we do a lot of those sitting on this dais. And so if you could, please, before I make my remarks.
Sure, so actually, you know what? I'm actually gonna read it to all of you because I think that will actually be of some value, so hang on. So just so we're absolutely clear, we're talking about, I'm on page 8, Exhibit A to the MOA. At the top, we're in Part 2, Prevention, Section F. And we're focused on number 1, funding medical provider education and outreach regarding best prescribing practices for opioids consistent with the guidelines for prescribing opioids for chronic pain from the U.S. Centers for Disease Control and Prevention, including providers at hospitals, and then in parens, academic detailing. Is that, do you want to focus on that section or on the rest of Section F?
Yeah. I think Section F has been part of the discussion tonight.
Sure. So I mean, there's that piece, and then number 5 down here too. I think there's been some talk about the prescription drug monitoring program. So again, there is a provision in the memorandum that says that this can be amended, right? So that is a possibility. There's also language at the beginning of Exhibit A that does talk about that. These are not. I should read the actual language to you, so I'm not just talking off the top of my head here. The programs and strategies listed in this exhibit are not exclusive, and fund recipients shall have flexibility to modify their abatement approach as needed and as new uses are discovered. So again, Councilmember Schultz talked about flexibility, but I think there is flexibility built in here, right, about fund members, there's broad guardrails here, right, of spend this money to fix the opioid crisis, right? That is the outer boundaries. We don't want it to be used to pave potholes, right? I think it is meant to address the crisis. But within that, this memorandum of agreement has flexibility built in for each jurisdiction to make an informed choice about, look at this list, pick the things that you like or that you think make the most sense for your jurisdiction, and go ahead and spend the funds on that within the confines of what this lays out. It's not saying that, there's probably, 100 different items here. It's not saying that each item has to be funded. It is choose the ones that, get a process going, and then choose the ones that work for your area.
Okay, thank you.
Mm-hmm.
Thank you. First, okay, Councilmember Schultz.
Neither cities nor counties would be able to enhance or improve the prescription drug monitoring program. So that is not something that is on our à la carte, but that is something that we are signing on to, that we agree.
So we're talking about.
So, like Burnsville can't say, oh, well, yeah, I'm going to improve that. We also can't say, no, state, you can't improve that. That is something above what we do. So when you're talking about there's flexibility in it, that's not flexible. That's not something that is flexible for this body. This is not in our a la carte.
Sure, and it sounds to me like the issue then is not about whether or not the city of Burnsville joins the settlement. It's about how the state of Minnesota, or the legislature, deals with the state share of the settlement funds, correct?
Yeah.
Yes, that's part of it. That
Okay, so I guess I view that as
actually is
separate.
part of it.
Yeah.
So, yes, and when we sign on, we say that we are agreeing with that. That's why it's a memorandum of agreement.
See, I don't agree. I guess that's I wouldn't take the premise that far. So I would say Burnsville signing on means that, yes, you are signing on to this document. I don't think it means that the city of Burnsville is approving the spending of every other jurisdiction in the state that's receiving settlement funding. I think that's two entirely separate things.
I don't think that it would say that we're agreeing with how Lakeville spends their money or Dakota County spends their money, but this is the state. That's different. We would be saying we agree with that.
I don't agree with that, but this is in agreement negotiated by the state alongside cities and counties for funds to come in across the entire state. The question is whether Burnsville participates or not. I don't think it's a question of, the blessing by Burnsville of state policies, but maybe that's just a matter of different perspective.
Okay. Thank you, Mr. Maloney.
Thank you very much, Madam Mayor.
First, I want to thank all of you for coming and sharing your thoughts with us.
And hanging tough.
You have all educated us. You shared your thoughts and your heart. I also want to thank all of the citizens of Burnsville who, since this issue came to the forefront, wrote to us, called us, and poured their hearts out to us in their emails and in their phone calls. I want to thank Representative Baker. You have been someone who raised this issue and told your story and why you're in this and why you believe that this is the direction that we need to go. Thank you for coming from Wilmer, because this is an important thing for you. And you have a direct reason because of your son's death. And I'm sorry for your loss. As a parent, we all feel that pain each and every day. And to the members of the state, thank you for coming. And to the Attorney General's office, thank you for being here. This is a difficult subject, but tonight we're being asked to be part of the settlement. But we also have raised a lot of issues that I know you will work on, because I have seen the diligence of your work on this issue, and that you believe that you need to also fix. Often you have said, we will fix it. There are bills that will move forward. There are things that we as human beings know that if it isn't correct, then we fix it. And this issue, if I understand correctly, has been a bipartisan issue at the state legislature, because it's an important issue for all of us. For physicians, so that they don't lose their license. For patients, so that they can have access to medication. But on the other end, we also know that there is an epidemic. And it's not just here in Minnesota or in Burnsville, but it's across the country. So for me, when I look at this and we say, yes, we're asked to be part of the settlement. And I look and I say, yes, the settlement has already, that negotiation has already taken place. Now, is Burnsville going to be a part of it and receive some of the funds? Tonight, and in a lot of the emails, I've heard from people who says, we can use the funds. I heard from our chief, police and fire, and they spoke about the experience in Burnsville. And if there is a menu list of how we can use those funds, I know we could use another social worker in the behavioral health unit. Councilmember Schultz did a presentation, a fine presentation that looked at childhood and the beginning of that journey of addiction and how it happens. But then we also heard from some of the testifiers this evening and said, there is a way for us to do that. There is education. And the other thing that I do know, and it is about the pandemic and even before that, here in the city of Burnsville, mental health is not a bad word. No. We know each and every one of us in our journey through life experience times when we do need help. And so we do reach out. In the city of Burnsville, and I think in a lot of cities, they have employee assistance programs. Why? Because if people are suffering some kind of issue in their life, there's that access to service that they can have. And if they need more, our insurance pays for it. And I think more and more insurance companies are paying for mental health services. So for me, I am hopeful. There are people like Representative Baker and people who know that if we work together, we can solve all of these issues. So I'm optimistic. And I know that for Burnsville, even the 1.1 million throughout the years, can benefit our community. And so I am going to be sticking to my original vote and say yes, that we will be part of this effort. And that I hope that we can address the issue with physicians and address the issue with regard to physician-patient. And so I'm looking to you, Doctor, and making sure that we can move through all of that, Dr. Kendi. And on the legislative side, Representative Baker, I trust that you will continue your good work, and I trust that you will continue to work with the AG's office, and that we will get to that. So, is the council ready to vote? The clerk, and we just need 3 votes to be a part of the settlement. And the clerk would take the roll, please.
Gustafson.
Aye.
Couts.
Aye.
Keeley.
Aye.
Schultz.
No.
Workman.
No.
Okay. And the clerk has the division of the House.
I do, Madam Mayor.
Thank you. And the memorandum is approved. And thank you, everyone, for coming. Thank you for being here. And I think we are moving forward. And thank you for all of the work that you have done.
Thank you, Council. Thank you.
Thank you. Okay, and members of the council, there are no other issues to come before us, and a motion to adjourn is in.
Oh, motion to adjourn.
Okay, there's a
Second.
motion and a second. All in favor, please say aye.
Aye.
Aye. Opposed, say nay, and the motion carries.
Sorry.